Check. Good morning. I request all of you kindly be seated, please. We are beginning now. Also keep your mobile phone on a silent mode. Check. So, are we ready to go? Can I kickstart? Once again, a very, very good morning to all the respected doctors. Myself, Siya Patel, the host for today. On behalf of All India Federation of Government Doctors Association, it gives me immense pleasure and honor to welcome each one of you today for the most awaited meet and conference, that is of AIFGDA Meet and Conference Mumbai 2023. तो एक जोरदार तालियां आप सभी लोगों के लिए जिन्होंने अपना कीमती समय निकाल के आए हैं। सबसे पहले कहना चाहूंगी, हमने जैसे कि हम सब जानते हैं कि इस संस्था की स्थापना 2014 में हुई थी, आज से 10 साल पहले। लेकिन कुछ साल के गैप के बाद, कई सालों बाद हम फिर से मिले हैं। कई दिनों की मेहनत है, कई सालों बाद मिले हैं और आज का जो उद्देश्य है, जो मीटिंग है, वो बहुत ही फ्रूटफुल होने वाली है, बहुत ही नॉलेजेबल होने वाली है, क्योंकि आज का हमारा विजन है ग्रीन क्लीन डिसिप्लिन। साथ ही साथ हम बहुत सारी चीजों पे बात करने वाले हैं। हम वैसे कितने साल बाद मिल रहे हैं, कोई बता सकता है? मतलब ये इंस्टीट्यूशन में हम लास्ट कौन सी हमें मिले थे सब एक साथ? 2019, तो ऑलमोस्ट 4 साल बाद हम सब मिल रहे हैं। तो ये जानना चाहूंगी, 4 साल बाद जो मिलने का आप सभी को, आई वुड से पैन इंडिया से आप सभी आए हैं, वेलकम टू आमची मुंबई। तो ये कहना चाहूंगी कि जिसने हम सबको फिर से एक बार फिर से इकट्ठा किया कई दिनों की मेहनत के बाद, ताकि हम सबके लिए हर चीज में वो स्टैंड ले सके। ये इंस्टीट्यूट जो फेडरेशन है, ये हम सभी के लिए है, टू टेक अ स्टैंड ऑन, दैट इज हम CME पे बात करेंगे, दैट इज वायलेंस ऑन डॉक्टर्स, और बहुत सारे उद्देश्य पे बात करेंगे। आज के जो दिन है वो बहुत ही नॉलेजेबल है, बहुत ही फ्रूटफुल है। कहते हैं ना, डॉक्टर का समय सबसे ज्यादा कीमती होता है। तो आपने आज हमसे अपना सबसे कीमती तोहफा दे रहे हैं, वो दे रहे हैं आपका वक्त। लेकिन इससे पहले मैं आज का इवेंट शुरू करूं, मैं चाहती हूं वो शख्स के लिए जिन्होंने हम सबको यहाँ पे इतने लोगों से कोऑर्डिनेट किया, सबको इकट्ठा किया, ताकि हमारे जो हम सब बिजी हो गए थे, क्योंकि डॉक्टर्स की लाइफ में कोई टाइम की कमी रहती है, हम सबको फिर से इकट्ठा किया, हम सबके बारे में सोचा, एक स्टैंड पे लेके आया है। तो मैं चाहूंगी जिन्होंने इतने दिनों से मेहनत की, राजेश जी के लिए, दैट इज राजेश गायकवाड़। यस, हमने सुना है कल वो प्रेसिडेंट बने हैं, हमारे न्यू प्रेसिडेंट जी के लिए ढेर सारी तालियां होनी चाहिए उनके लिए, और ह्यूज राउंड ऑफ अप्लॉज, अ बिग बिग थैंक यू टू हिम। इससे पहले हम आगे बढ़े, मैं कहना चाहूंगी, सबसे पहले तो मैं बुलाना चाहूंगी हमारे स्टेज पे हमारे बीच जितने भी डॉक्टर्स है, आई वुड से ऑल द रिस्पेक्टेड डॉक्टर्स। लेकिन उसके बीच में हम कहना चाहेंगे, आई वुड रिस्पेक्ट माय डिग्निटरीज टू फर्स्ट कम फॉरवर्ड एंड काइंडली बी सीटेड ऑन द डायस। आई रिक्वेस्ट ऑल द पीपल, एज आई वेलकम देम, आई रिक्वेस्ट ऑल ऑफ यू, लेट्स वेलकम देम विद अ राउंड ऑफ अप्लॉज। First and foremost, I would like to invite our former president, that is AIFGDA, Dr. Rajesh Kalia. Come on, जोरदार तालियां. Sir, I request you to kindly be seated. जीतू, बहुत अच्छा होगा if you can add up some music. We have got a wonderful DJ today, and he'll be keep playing some tracks. Next, I would like to invite our formal gender. We will Rocky will have later, buddy. Can we have some different track? So now we're starting it up. Now I'm calling up with full honor and respect our General Secretary, that is Dr. Ranjit Kumar. Come on, the former General Secretary of AIFGDA. जोरदार तालियां होनी चाहिए, come on, हमारे General Secretary के लिए. And yes, जिन्होंने इतने दिन से मेहनत की है हम सबको फिर से इकट्ठा करने के लिए, हमारे लिए स्टैंड लेने के लिए, कुछ करने के लिए, ये इंस्टीट्यूट के लिए। तो पूरे सम्मान से उनका नाम ले रही हूँ, हमारे न्यू प्रेसिडेंट जी एज डॉक्टर राजेश गायकवाड़ जी फ्रॉम AIFGDA। कम ऑन, उनके लिए भी ढेर सारी तालियां हो जाए। फिर मैं बुलाने वाली हूँ यस, जिनकी डिग्रीज पे ऐड ही होते जा रहा है, जितने इनके बारे में कहो उतना कम है। आई वुड ऑल्सो लाइक टू इनवाइट डॉक्टर राजेश देरे जी। कम ऑन, जोरदार तालियां से इनका स्वागत करिए। नेक्स्ट आई वुड लाइक टू इनवाइट and very honorable and respected full doctor, that is Dr. Madhav Hasani। जोरदार तालियां इनके लिए भी है, हसानी जी। Next and lastly I would like to invite a very intelligent, a life savior, that is Dr. Subrata Goswami। Come on, जोरदार तालियां, come on। Thank you। तो सबसे पहले मैं कहना चाहूँगी कि बहुत ही फेमस फ्रेज है, ईश्वर सबके जीवन की रक्षा खुद नहीं कर पाते। ईश्वर सबके जीवन की रक्षा खुद नहीं कर पाते, इसलिए इस धरती पर अपने रूप में डॉक्टर को भेजा है। थैंक यू डॉक्टर्स। वैसे हर प्रोफेशन अपनी जगह उम्दा होता है, लेकिन हमें डॉक्टर की सही अहमियत तब पता चली ड्यूरिंग द टाइम ऑफ द कोविड वॉरियर्स। वीबी शाह, मैं पूरे सम्मान से इनवाइट करना चाहूंगी डॉक्टर वीबी शाह फ्रॉम वेस्ट बंगाल। कम ऑन, जोरदार तालियों से इनका भी स्वागत कीजिए। I'm heartily welcome you. Okay. और जब कोविड का टाइम था तभी हमें डॉक्टर की सही अहमियत मालूम थी। जैसे हमारे लिए बॉर्डर पे सोल्जर्स लड़ते हैं, वैसे ही हॉस्पिटल्स में उनके लिए कहा जाता है ना कोई दर्द ना कोई आराम, बस जिंदगी देश के नाम। वो था हाल हमारे सभी डॉक्टर्स का, दे आर द वॉरियर्स, दे आर द लाइफ सेवियर्स। लेकिन जो कोरोना के वक्त पे डॉक्टर्स ने हमारा साथ दिए हैं, सर झुका के उनका सलाम करते हैं। तो चलिए इसी बीच हमारे कुछ बहुत ही हार्ड वर्किंग और बहुत ही उम्दा, जिन्होंने देश के नाम अपनी जिंदगी कर दी। तो सबसे पहले आई रिक्वेस्ट ऑल ऑफ यू टू प्लीज रेज, 1 मिनट के लिए हम श्रद्धांजलि देंगे, 30 seconds के लिए। I request all of you to please raise. Let's have a Shraddhanjali to all the people who sacrificed their life. Thank you. I request everyone kindly be seated, please.
Sorry, I have to intervene. Actually, we have one more special condolence today for late Dr. Iqbal Bharti. He was our founder member of the AIFGDA from the very beginning, and he was husband of our Nasrin Didi. Nasrin Didi is here. I will also request to call upon on the stage Nasrin Didi, please once. And today we are going to have a CME on violence against doctors, and Dr. Iqbal Bharti was a victim of violence against doctors. So that's why it is always we'll always remember him with great love and respect. So I'd once again request everyone to stand for 1 minute to pay a special homage to Dr. Iqbal Bharti, our founder member.
Thank you everyone.
कंटिन्यू करो डॉक्टर सवालना, कंटिन्यू करो।
You want to say something, sir?
ओके ओके।
ओके, तो सबसे पहले हार्दिक बधाई देना चाहेंगे, दैट इज डॉक्टर राजेश गायकवाड़ जी को, हमारे नए प्रेसिडेंट। सर हार्टली कॉन्ग्रेचुलेशंस और तहे दिल से थैंक यू कहना चाहेंगे। आपने पैन इंडिया जितने भी डॉक्टर्स थे सबको इकट्ठा किया, सबको एक चैनल पे लाया, सबको एक एसोसिएशन का फिर से कहा था ना, सब अपनी अपनी लाइफ में थोड़े से बिजी हो चुके थे, लेकिन अपना कीमती समय निकाल के आप सभी को इकट्ठा किया आपके लिए। दैट इज कहीं मुद्दों पे जो भी स्टैंड लिया जाएगा, जो बात की जाएगी, तो तहे दिल से एक बार फिर से जोरदार तालियां होनी चाहिए राजेश गायकवाड़। तहे दिल से थैंक यू ऑन बिहाफ ऑफ ऑल द डॉक्टर्स प्रेजेंट हियर। To kickstart the event, we're starting it up with an auspicious lamp lighting ceremony. As we all know, this lamp lighting is a symbol of prosperity, light, and success. Yes, sir. I request all the dignitaries to please come forward for the lamp lighting ceremony. Yes, DJ, you can play some background tracks. I request all the dignitaries to please come forward for a lamp lighting ceremony. I request the dignitaries to please light the lamp, light that wick together. After lighting the tree, let's freeze this moment with a picture. Let's freeze this moment. Thank you. इसी के साथ टेक द लॉर्ड्स ब्लेसिंग, गणपति बप्पा मंगल मूर्ति। तो चलिए इसी के साथ भारत माता की वंदे। टू किक स्टार्ट द इवनिंग, मैं आज का दिन कहना चाहूंगी, आज का जो दिन है वो बहुत ही फ्रूटफुल है, राइट फ्रॉम द मॉर्निंग टिल द इवनिंग। आज का जो दिन है वो बहुत ही नॉलेजेबल होगा, नेटवर्किंग होगा। जैसे कि मुझे पता चला है कि हम यहाँ पे पैन इंडिया से आए हैं, राइट, पूरे ऑल ओवर इंडिया से आए हैं। कोई वेस्ट बंगाल, तो कोई हिमाचल, कोई केरला, ऑल ओवर, कोई मुंबई, कोई नासिक। हमें अक्सर आज जो हमें मौका मिला है वो बहुत ही फ्रूटफुल मिला है, एक दूसरे से कनेक्ट करने का, नेटवर्किंग बढ़ाने का। तो मैं चाहूंगी, हमें अक्सर ऐसा होता है, ऐसे सिचुएशन में ऐसा होता है कि सब लोग अपने अपने फ्रेंड्स के साथ एक सर्कल में बैठ जाते, एक टेबल पे बैठ जाते, हमें पता नहीं होता हमारे बाजू वाले टेबल में कौन बैठा है। तो मैं चाहूंगी जितने भी लोग हैं अपने जो बाजू के टेबल है उनसे हैंड शेक कीजिए। Come on everybody, handshake with each other. Introduce yourself. Introduce yourself. Come on, introduce yourself. Introduce yourself. Introduce yourself. Okay. And with this, let's have a music for all the doctors. Doctors, आपको मेरे को फॉलो करना है जब मैं आपसे कहूंगी, क्योंकि आप लोग चैंपियन हो, आप लोग हमारे सोल्जर्स हो, आप लोग धरती पे हमारे विधाता हो। जब मैं कहूंगी 1 तो 1 क्लैप, जब मैं कहूंगी 2 तो 2 क्लैप्स, ठीक है? DJ, can we have a music? We will rock you. Are we ready to go? DJ, play them some music. Come on. जीतू, are we ready to go? Cool? आपने सब एक दूसरे से मिल लिए? Play the track. 1 2 2 1, hands out, 1 2 2 1 1 2, center, 1 2 2 1. We will rock you. Thank you DJ, thank you. तो yes, हमारे जितने भी डॉक्टर्स हैं उनके लिए हम हमेशा स्टैंड लेंगे, उनको हमेशा उनकी पोजीशंस जो इतनी स्ट्रांग है उनको हक हमेशा दिलाएंगे। इसीलिए हमारे फेडरेशन है, इसीलिए हम यहाँ सब इकट्ठा हुए। तो अभी ज्यादा वक्त नहीं लेते, इसी के साथ हम शुरू कर रहे हैं आज का प्रोग्राम।
CME का ओपनिंग हो गया, CME है, बाद में ये सब चीजें 12 के बाद के प्रोग्राम।
ओके, तो इसी के साथ मैं बुलाना चाहूंगी हमारे फर्स्ट स्पीकर को, who is going to talk about the violence against doctor and challenges to overcome. For that, but I would also like to request the people to please come forward and be seated up on the dais. And I request all my respected dignitaries kindly be seated, please. Thank you. First and foremost, I would like to invite the respected doctors on the dais. Firstly, as I call upon their name, so I request my chairperson to please come forward and be seated up on the dais. First and foremost, she's a working president of AIFGDA of Rajasthan, Dr. Nasreen Bharti. जोरदार तालियों से हमारे chairperson का मंच पे स्वागत करेंगे. Come on, Dr. Nasreen Bharti, a very knowledgeable, intelligent doctor. Then we have a founder member of AIFGDA Telangana. He's also the founder of VP Telangana Teaching Doctor Government Doctors Association. Ladies and gentlemen, put your hands together for Dr. Kiran Madhale. Come on. Let's welcome all the respected chairperson with a round of applause. I won't keep you waiting any further. It's time to invite our speaker. Humble note to all my speaker, the time slot given to all the speaker is 30 minutes. Towards the end of 25 minutes, we'll be ringing one ring, and towards the end of the 30 minutes, we'll have a finale ring. So let's start it up. So here I call upon Dr. Rajesh Zire. He has been known for his variety of things. He has won a lot of awards and accolades. He got a testimony of appreciation in his own handwriting by the Nightingale of the India, Bharat Ratna, late Srimati Lata Mangeshkar, for excellent contributions in the COVID-19 pandemic. He is also awarded as a Mahatma Gandhi Samman for the contribution in the COVID-19 pandemic by the NRI Welfare Society at India at Achievers World Forum, conducted at the Global India Summit in the prestigious House of the Common, London. He has been also successfully leads India's largest and the world's second transition 100% COVID hospital with 2,500 beds, as well as India's largest COVID vaccination center at BKC Mumbai. He has been also proven administration skills plus 10,000 प्लस कोविड पेशेंट, 10,000 से ऊपर उन्होंने कोविड पेशेंट को डिस्चार्ज किया। एक ही वक्त पे उन्होंने कई लोगों को देखा है और उनको बहुत ही अच्छा ट्रीटमेंट दिया है। डिस्चार्ज फ्रॉम द फैसिलिटी फेज 1 विद अ नेशनल लेवल रिकॉग्नाइजेशंस विदाउट मोर्टालिटी। दैट्स अ ग्रेट नंबर। 10,000 पेशेंट को एक साथ देखना, एक साथ डिस्चार्ज करना और उनको फिर से जिंदगी देना। अप्रिशिएट बाय द डॉक्टर्स विदाउट बॉर्डर्स, यस, वेयर मेडिसिन सेंस फॉर from Germany for providing access to the healthcare service during pandemic COVID-19 pandemic. He's also got a certificate of appreciation by the government of Maharashtra, Shri Bhagat Singh Kasyani, for exemplary work in the fight against coronavirus. He's been also felicited by Honorable Chief Minister of Maharashtra, that is Balasaheb Thackeray, for valuable contributions in the pandemic in the inaugurations of the BKC, that is the COVID vaccination center. He's also certified of the world record holder for India's first and the largest transit COVID hospital by the World Record India. That's the highest achievement, I will say. Is the recipient of Atmanirbhar Bharat Award, that is Bharat Award Vision of New India at 62 National Summit India's Achievement Forum, New Delhi. He has conducted around, yes, more than 20,000 medical legal postmortem and around 1,600 cases of victim and accused of sexual assault, including POSCO cases till date. इनके बारे में जितना कहे कम है, सब मैं आपके साथ सेल्फी जरूर लेके जाऊंगी, मेरी पेरेंट्स को भी दिखाऊंगी, they'll be proud of me today. So ladies and gentlemen, be ready. जिनके बारे में जितना कहे कम है, he is also started as a one-stop shop center of a survival of sexual assault in Mumbai at Sion Hospital in Mumbai. He is an instrumental in establish a state-of-the-art medical complex at many places in Mumbai. He is appointed as the medical expert by the government of Maharashtra. Taj terror strike. Wow, he's a savior. He's a soldier right up on the stage during trial and a special designated coal author role. Come on, इनके लिए जितनी तालियां हुई उतनी कम है, I would say this. Come on, everybody. He has been also a special forensic team from France and investigation and the conditions of the victim is the Taj terror strike. Medical legal expert assisted and opinion given during the investigation by appreciation by Consulate General de France of Mumbai. He's been also the medical legal expert assistant and opinion given during the Taj terror strike investigation by the appreciation of the government of Maharashtra. He's the forensic expert who lead forensic investigation and played a major role in identification of decreases of known terrorists and Mahim blast case. He's a forensic expert who leads forensic investigation for the cause of death in Kamla Mill case. I'm sure we all know about it. Kamla Mill case, fire case in the year 2017. He's a forensic expert also in Elphinstone Bridge collapse strategy. He's appointed as a medical expert by the Superintendent of Police Raigarh during 2007 to assault guiding highly sensational foreign citizens during licensing in New House. So all the people, ladies and gentlemen, put your hands together for the one and only one of true soldier, Dr. Rajesh Vede. Come on, एक जोरदार तालियां होनी चाहिए.
Hello. So thank you for your kind introduction. And let me thank and welcome you to Mumbai, all of you from all the states, and undoubtedly my friend, best friend, my colleague, who gave us this opportunity to be a part of your great organization, Dr. Rajesh Gaikwad and Dr. Abhijit Osmani. Really, why we think, we just started 20 days before, 25 days before, and in between, during rains also, Dr. Rajesh came to me, but I said, you request your office bearers that Mumbai rains are heavy, and if you plan in July, because of rains, there are chances every time that Mumbai is at halt for a day or two. So he selected a very good date, and God is kind to us. There are no rains for last few days, and it will not rain today also. It will not rain tomorrow also. So you will really enjoy Mumbai life and the environment of Mumbai. So thank you, all of you, for providing me this opportunity. Now, why we selected this topic? You select this, na? See, what we thought, why there has to be a tag of violence against doctor is that for last 5 years, even before COVID, there were landmark violences. If I could recollect, one is one of our office bearer or delegate is from West Bengal also. There was such a physical violence to one of our fraternity or registered medical practitioner, and these goons, I would say nowadays in society, after enactment of Consumer Protection Act, after the order of Honorable High Court of Kerala in 1996, it all started from consumerism only. If those who are in 50s like me, young 50s, I would say, during our college days in 90s and 2000, the attitude of the public was very different before consumer era. That time, our services were not under Consumer Protection Act or not as to be considered as a consumer. So लोग हमको जब आते थे, कोई भी डॉक्टर हो, छोटा हो, बड़ा हो, कितना भी बड़ा इंसान पेशेंट वीआईपी भी आता था, तो डॉक्टर साहब को भगवान के जैसा बात सुनता था. I would tell you my experience in 90s when I was in UG. Even though hardcore criminals we used to examine in forensic, hardcore, I can name them also which we have examined. वो डॉक्टर के सामने he was so cordial and he was so respectful. But now see the situation, what has happened now to the fraternity, practicing fraternity, and what are the reasons. That is what we are going to discuss now. Please keep mobiles on vibration mode. Please, one more request to all the delegates. And for last 5 years, if you go through the papers, we can easily say that medical fraternity is at receiving end, I would say. To whom? To politicians, to whom? I would say even investigating officers also. Attitude of the police, if any of the local leader, I would say, there is now tagline in part of our country, social worker, so-called, but everyone is affiliated to some political party. They act like a mediators and catalyst. What is catalyst? They will enhance the activities. बीच में आके बोल देंगे, अरे डॉक्टर ने बराबर ट्रीट नहीं किया, आप सिर्फ चिल्लाओ, हम लोग जमा कर लेंगे. And then print and press media, what is the condition in our country. उनको क्या है, वो मसाला चाहिए, and they will just come to your clinic. They will just what they will do. अरे उल्टा किया क्या है? थोड़ा स्टार्ट से करूँ. स्वाति थोड़ा आके देखो इसका. Swati, be here. So what they will do, they will act mediator as an blackmailer, so-called, in tagline. They will make a issue. They will create a fear against you in the society, and then वही एक बंदा आएगा आपके पास, बोलेगा मैं सेटल करके दूँ क्या आपको? This is the trend what has been started of late. In last 5 years I have seen, you can go through many newspaper maybe of your state, national newspaper. I would say in every 15 days or 10 days, you can hear some part of violence. May not be physical, they may be psychological violence, or any part of country, some doctor has been at the receiving end. So what we have to do is, what we need to do now is, how do we prevent this? Now see, for prevention I would say there are two ways. Following a set protocol of medical standards given by various authorities, main Medical Council of India or now NMC, ICMR, various protocols of each state government given in hospital administrative manual of every state, various laws of our country, and I would say more about this, we should have now good communication skill to practically manage the violence. This is very important. When I give medical legal consulting, drafting, and when we manage in the IMA, and there is one good association of medical consultant, you in Mumbai, is one of the national best association only for specialty and super specialty doctors. So they have formed a group, a ground level group, to come at this spot and manage practically. See, protocols are there, laws are there. I may say in a mob, mob psychology is completely different. I may say, देखो मेरे गवर्नमेंट का GR है, मैंने काम किया गवर्नमेंट हॉस्पिटल में, but the mentality of the mob in front of you is somewhat different, because they are in a mind frame in which they feel कि डॉक्टर की गलती हो चुकी है, मेरे पेशेंट को एडवर्सिटी आ चुकी है, माई पेशेंट हैज़ डाइड. तो आप कितना भी वो, जैसे हॉस्पिटल में हम हर एंट्री में लगा रहे व्हाट आर दी लॉज, इफ़ यू पब्लिक सर्वेंट ऑन ड्यूटी, ब्ला 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 सेक्शंस, वो कोई देखता नहीं उस टाइम पे, बिकॉज mob psychology is completely different. So on various platforms, this menace, I would say, against the medical fraternity has to be managed. It cannot be a single line of management, and for that we always say in IMA talks, you should form a local group. हमारे में क्या हो रहा है मालूम है, जो प्राइवेट प्रैक्टिस करते हैं, देयर इज़ ए प्रोफेशनल GLSE, इसकी प्रैक्टिस कम करनी है, मेरी ज़्यादा करनी है, तो 50% cases I go to State Consumer Forum as an expert. I would say 50% of the cases against that registered medical practitioners are instigated directly or indirectly by one of the registered medical practice. I can give you names also, big names. So this part, what happens, everyone has to excel in his own field. सबको मैं फोरेंसिक में, आई ऑल्सो फील मेरा नाम ऊपर होना चाहिए, सेम विद गायनेकोलॉजिस्ट, मेडिकल ऑफिसर्स, बट व्हाट वी आर डूइंग, हु इज़ माय कॉम्पिटिटर XYZ, तो उसके बारे में हाउ टू गिव नेगेटिविटी टू द ओपोनेंट्स, उसमें हम ज़्यादा वक्त ज़ाया कर रहे हैं, एंड वी डू फेल कि वी कैन बी ए पार्ट ऑफ दैट वन डे, कभी तो हमारे पे भी आने वाला है. So this is where practical management. Now violence against doctor and healthcare professional is a concerned issue that has been reported in various part of it. Refers, it is not only a physical, verbal or psychological aggression targeted at medical practitioners, nurses and other healthcare staff. This violence can occur in hospital, clinics and other healthcare units. Now I would say beyond this, there are reported cases in which even a medical officer, or I will say registered medical practitioner or paramedical staff, are targeted other than the area of the hospital, bahar mil bolke. Somewhere he is in bazaar or somewhere he is in mall or somewhere he is moving out, wahan bhi they catch hold of them and do some physical or verbal violence based on that cases. Now what are the several factors we have to look into this? Emotional stress. See this, some video we have shown you the way gundas, this I would say they are gundas. They are not the aggrieved people for me. If they behave in this way, and what is now government hospitals, security naam ke liye. Means, see, I am 25 years in this. I have led this all 9 jumbos of Mumbai. I have at Sion Hospital for the last 22 years, part of administration. Security is just a physical presence. When such, see, in casualty or inside they are coming and thrashing, every hospital has some security. Now even private nursing home do keeps private security. Every government hospital now have a police chowki in Maharashtra inside. We have made sure that. But when this violence takes place, they will never protect you. You know, वो क्या कहते हैं ना जैसे फिल्म में कि पुलिस हर बार आखिरी आती है सारा होने के बाद. Same with security. They will be a good spectator to you, or when everything is done, you are thrashed, then they will come. अरे अभी पुलिस को बुलाए, चलो चलो डॉक्टर साहब को लेके जाके FIR करते. But you know, there is no prevention basically. When already damage has been occurred on the doctor, not only physically to his reputation, total career is devastated because of such act. सिर्फ तुम्हारी प्रैक्टिस खराब नहीं होती या 2 लैसरेशन से कोई फर्क नहीं पड़ता मुझे, but your career is at stake. Your family has been defamed because of this. There are various factors. So these emotional factors because of patient emotions, long wait time and frustration. This may not apply to private hospital, but हम सारे गवर्नमेंट हॉस्पिटल के हैं, हमारे यहाँ लॉन्ग वेटिंग है बिकॉज वर्कलोड इज देयर. यू कम टू सायन, हमारे यहाँ डेली 7,500 की OPD. एक मेडिसिन का SR हो या कोई भी फैकल्टी है, वो 150 पेशेंट 3 घंटे में देख ही नहीं पाता. अगर वो देख भी लेता है फास्ट, तो वो एक कंप्लेंट है डॉक्टर ने हमको बराबर से नहीं देखा, मुझे सिर्फ हाथ लगाया और बोला ये ट्रीटमेंट ले लो. देन ऑल्सो दे विल कम एंड फाइट विद यू. डॉक्टर सिर्फ VIP को देखते हैं. देन disagreement over treatment nowadays. Why disagreement? You know, in last few years, Android, mobiles, social media, and worst part is WhatsApp University. You know, I would say कि it should be banned now someday. 90% गलत चीज़ें अगर वहाँ आएगी तो वो WhatsApp पे आएगी. I will give you, you know, as part of, still I hold charge of Dean of all Jumbos. First wave में I will give one post when it was circulated in WhatsApp, you know, first कि अगर आप गर्म पानी रोज पियोगे तो कोरोना वायरस मरता है. You know, people starting, you know, गर्म पानी, and after 8 days ENT OPD की लाइन बढ़ गई. सेकेंड एग्जाम्पल आई विल गिव. एक पोस्ट वायरल हो गई थी कि अगर आप दारू पियोगे तो कोरोना वायरस मरता है. यू विल नॉट बिलीव इन दैट रेस्ट्रिक्शन पीरियड ऑफ फर्स्ट वेव व्हेन देयर वाज ए लिटरली लॉकडाउन, मुंबई में जो वाइन शॉप है 2-2 किलोमीटर की लाइन लग चुकी थी. आई डोंट नो अदर स्टेट, एवरीवेयर सेम. सी दिस इज व्हाट, you know, what I say कि they always read now, you know, patient coming to you educated, क्या है, I am suffering with headache. You know, take example. मैं सारा गूगल सर्च करके everything is there. मैं पूरा मेरा हिस्ट्री बना के डॉक्टर के पास आता. will come and doctor will say, suppose he will say नहीं नहीं नॉर्मल हेडेक है, साइनस है, कोई डॉक्टर, देर इज़ नो नीड टू डू एनी इन्वेस्टिगेशन, आप थोड़ा स्टीम ले लो, ये 2-3 मेडिसिन ले लो, यू नो, एंटी हिस्टामिनिक और पेन किलर, 3 दिन में आपका ठीक हो जाएगा. दे विल क्वेश्चन यू, डॉक्टर गूगल में तो ये लिखा है कि हेडेक कैन बी ए ट्यूमर ऑल्सो. डॉक्टर अरे ऐसा कैसा, आप मेरे को कोई सीरियसली नहीं ले रहे हो. देन दे विल क्वेश्चन योर एबिलिटी इवन दो यू गिव गुड एडवाइस. And that is one of the reason defensive medicine is at peak now. You know what is defensive medicine? We all know. यही चीज़ है, क्योंकि हमको भी मरना नहीं है ना. So then doctor also feel उनको खर्चा करना है, करने दो, मैं सारा बैटरी ऑफ इन्वेस्टिगेशन लिख लेता हूँ, थोड़ा मैं भी कमा लेता हूँ, उनको भी खर्चा कर देता हूँ. See, this is where then lack of communication. This is worst, I would say. You know, in BKC, we were first in India to have a patient ID. मोदी साहब ने 2 साल पहले 15 अगस्त को बोला था कि हर सिटीज़न को ID चाहिए. वो हमने BKC में बनाया था. आज भी मेरे मोबाइल पे एनी पेशेंट का मैं लॉगिन ID ओपन करता हूँ तो आई कैन गिव यू डिटेल विद इन 5 मिनट्स पूरा उसका. एंड वो ID हमने क्या किया था, पेशेंट एडमिट होने के बाद उसका जो लीगल हेयर घर पे बैठा है, बिकॉज इन कोविड नो वन वॉज अलाउड टू कम इनसाइड बिकॉज ऑफ ऑल सच ICMR गाइडलाइंस एंड स्प्रेडिंग ऑफ इन्फेक्शन. he can just log in with that password in that link, और वहाँ से he has access of all our reports, doctor treatments, daily rounds, and we had a tele-robot and medi robots from IIT we made, कि वो रोबो सामने जाता था, अगर वो पेशेंट को बात करनी है रिलेटिव से तो वो वीडियो पे घर से बात कर सकता था. See, if you increase communication and transparency, you will not believe, BKC में मैंने इंडिया का सबसे ज़्यादा पेशेंट 40,000 we have treated, and with least mortality of only 3%, and we had more than 200 bed ICU. It's not, see, communication, but there is no, last 3 years there is not a single RTI for me to demand any indoor papers, no cases against us. See, where the stress is, if you have good communication, be transparent, 90% of your allegations you can take care. So this we have to work on. Cultural and language barrier is everywhere. Resource limitation in government hospital. We all are victims of that. PHC में मेडिकल ऑफिसर को रहने को जगह नहीं होती, उसको जो व्हीकल मिलती वो चलती नहीं है, ड्राइवर खुद ही बनना है, उसको डीजल खुद ही डालना है, और सब सेंटर रूरल एरियाज में 15, 20, 30, 40 किलोमीटर्स लंबा है. So they are not providing you adequate resources. We don't want excessive resources. We want adequate resources. Then mental health issues. Now these mental health issues is not only for patients, even for doctors. So if doctors are working under such bad conditions, एक मेडिकल ऑफिसर डॉक्टर, लोड्स ऑफ पेशेंट, डेली ये रिपोर्ट भेजो, सब सेंटर विजिट करो, then we have to tackle with all local politicians, सरपंच, MLA, MP, PAC committees local, सबको मैनेज करना है. So mental strength is on either side. Now I would say lack of security measures is obvious. Lack of training and de-escalation technique. What do you mean, lack of training and de-escalation technique? Even though you all are senior medical officers or consulted in government, you tell me any of your government or even our government also, I am not pinpointing any state, we are talking generally, has taken any program to train us what is de-escalation technique. To tell me, one of you, have you any addressed any program, any state, and what do you of this de-escalation technique? What is de-escalation technique? It is just a training module in which, depending on the situation of alleged violence against doctor, how to de-escalate that. One example I will commonly give in every hospital, declaration of death, declaration of death. How to declare death. If you do it in a proper protocol, you de-escalate the stress of that relative. नहीं तो हमारे यहाँ क्या होता है, वार्ड में डेथ होती है, HO या रेसिडेंट आता है, हाँ हो गया तुम्हारा डेट, देख लो अभी बॉडी पैक कर लो, हमारा काम हो गया अभी, हम जा रहे हैं. हाँ, then that relatives has to search for ward boy, वो जगह पे मिलता नहीं, उसको ढूंढ के लाओ तो उसको कुछ तो खुश रखना होता है. देन बॉडी रैप करने को जल्दी कपड़ा मिलता नहीं, ट्रॉली भी रिलेटिव्स को खींच के वहाँ तक लेके जानी होती है. सी हाउ टू de-escalate. If you properly announce how to declare death, I would say give 2 minutes. We have done in Sion, but when the unit changes and resident changes, सब कुछ wash off हो जाता है. कि when death is there, one of the doctor of that ward just has to patiently talk with for 2 minutes with the leader. 2 मिनट उससे आप बात कर लो कि उसको इतना ही बोलो, we are also equally in grief. आपका हम दर्द समझ सकते हैं, हमने पूरी कोशिश की, आपने भी देखा, बट क्या कर सकता है, we have limitation in medical treatment, we have tried our best, बट आपकी बीमारी इतनी प्रोग्रेस हो चुकी थी कि उसको बचाना थोड़ा हमको इम्पॉसिबल था. तो आप भी थोड़ा समझ लो. एंड अगर वो डॉक्टर बोलता है ना वहीं पे आप चिंता मत करो, सारा मैं करा के लेता हूँ, वार्ड बॉय को मैं बुलाता हूँ, सिस्टर आई विल टॉक, आई विल सी दैट योर बॉडी इज रैप्ड प्रॉपरली, आई विल सुपरवाइज कि आपका बॉडी कोल्ड स्टोरेज तक प्रॉपर जाएगा, आई विल वाउच 50% ऑफ उसका जो एंग्जाइटी वहीं कम हो जाती। For last 24 years I am handling all postmortem services. जब तक बॉडी पीएम आती है ना, मीन्स कोल्ड स्टोरेज, मिनिमम 8 to 10 आवर्स स्पेंड होते हैं। 80% वो गुस्से में हमारे पास आ जाते हैं, फिर पुलिस उनको और 4 घंटा पंचनामा करके इरिटेट करती है, फिर हम भी उनको 4 घंटा पीएम करके और इरिटेट करते हैं। फिर जब 12-14 घंटा मेरी बॉडी नहीं मिलेगी तो किसी भी रिलेटिव्स का तो दे विल, वहाँ 200 लोग रो रहे गांव में, दे हैव टू गो फार। सो ये होगा, सी सम डी एस्केलेशन टेक्निक एवरी गवर्नमेंट हैज़ टू ट्रेन एवरी पैरामेडिकल स्टाफ एंड हेल्थ वर्कर। दिस आर जस्ट एग्जाम्पल्स वी हैव गिवन। नाउ नीड ऑफ द आवर, improve our communication. I would say communication skill development course should be started to all the doctors and paramedical workers across the states of our country. We should learn how to talk with the patient. We should learn how to pacify the relatives if these adversities occur. Public health awareness. See, हजारों करोड़ खर्चा पॉलिटिकल बोर्ड्स में लगाते हैं हमारे यहाँ। वही अगर पब्लिक हेल्थ अवेयरनेस ऑफ मेडिकल हेल्थ क्या है, ये व्हाट्सएप यूनिवर्सिटी में इंस्टेड ऑफ मेकिंग वायरल वीडियोस, वायरल पोस्ट कि डॉक्टर कितने गलत है, डॉक्टर कितना कमा रहे हैं, डॉक्टर क्या क्या कर रहे हैं, इंस्टेड ऑफ दैट अगर हम भी गवर्नमेंट हॉस्पिटल्स आर लैकिंग इन दिस। सी यू से कॉर्पोरेट वर्ल्ड, सी दी मीडिया हैंडल, दे आर प्रोफेशनल मीडिया हैंडल्स। वो महीने में एक अच्छा काम करते हैं बट उसको इतना वायरल कर देते हैं कि अगले 2 महीने वो रिलेट पेशेंट सोचता है हिंदुजा इज़ वेरी गुड, कोई भी कुछ बोलेगा तो हिंदुजा इज़ वेरी गुड। वी डू एवरीडे गुड वर्क बट वी डोंट प्रोजेक्ट इट प्रॉपरली। सी ऑलवेज कीप दिस इन माइंड। आज मीडिया इज सो स्ट्रांग कि आज मीडिया गवर्नमेंट बनाता है, गवर्नमेंट गिराता है। एंड लोग क्या है ना, जो सर्कुलेट होता है वो सोचते और पढ़ते, दे डू नॉट वेरीफाई। ना गया वो ज़माना, मेरे पास भी वक्त नहीं मैडम, मेरे पास भी एक वायरल वीडियो सर्कुलेट अगर होता है तो मैं सोचता हूँ सच ही हो सकता है। आई डोंट वेरीफाई, किससे वेरीफाई करूँ? जैसा कोविड में फर्स्ट 6 मंथ्स में इतने सुपरस्टिशन, कोई काढ़ा निकल रहा है, कोई गाढ़ा निकल रहा है, कोई बाबा अपना योगी बाबा बोलता है मेरा दवाई ले लो, कोरोना होगा ही नहीं, कोरोना ले। Who is going to verify? There is no government official platform for this. This is where our government lacks. For any information related to health, they should have an official government platform which should be daily updated. हमारे पास वेबसाइट है, आपके भी गवर्नमेंट की, हमारी भी है, अपडेट होती है क्या? देखो आज जीआर निकलता है, 15 दिन के बाद उस पर दिखाई देता है हमको। पैसे तो खर्चा हो रहे हैं, वो जो भी वेबसाइट वेंडर है वो क्या फ्री में दे रहा है? बट आप यू कंपेयर विथ कॉर्पोरेट हॉस्पिटल जैसा हमारे यहाँ हिंदुजा है, लीलावतीज है, उनका देखो आज कुछ होता है विद इन आवर अपडेट होता है सब। अगर मुझे कुछ हिंदुजा का देखना है, मैं आई विल ओपन दैट वेबसाइट, 10 मिनट में मुझे पता चलेगा कि आज ये डॉक्टर आ रहा है कि नहीं आ रहा है। सी दिस इज वेयर वी आर लैकिंग इन गवर्नमेंट इंस्टीट्यूशन, और हम उनसे बहुत अच्छा काम करते हैं। आई विल टेल यू एक एग्जाम्पल, व्हेन वी डिक्लेयर्ड दिस ना, जो फेज 1 में मेरा 10,000 पेशेंट विदाउट डेथ हुए थे, यू नो व्हेन इट वाज हाईलाइटेड इन टाइम्स ऑफ इंडिया फ्रंट पेजेस, सारा हंगामा हुआ, मेयर मिलने आए, सीएम मिलने आए। आई वॉज क्वेश्चन बाय ऑल द कॉर्पोरेट सीनियर कंसल्टेंट, बड़े बड़े नाम फिजिशियन, बिकॉज मैं तो फोरेंसिक वाला हूँ, उनको लगता है फोरेंसिक वाले को कुछ क्लिनिकल नॉलेज है ही नहीं, डिग्री नहीं है ना मेरे पास, सिंपल। एंड दे केम एंड सॉ माई सॉफ्टवेयर कि ऐसा हो ही नहीं सकता बोले। एंड आई अलाउड ऑल द कॉर्पोरेट, बड़े बड़े नाम नहीं लूँगा, जो भी टॉप के फिजिशियन इंटेंसिविस्ट ऑफ मुंबई, एंड दे इंटरेक्टेड विद मी, दे इवन टॉक विद दैट पेशेंट कि सच में इतने जिंदा थे क्या तुम्हारे पास, एंड देन दे रियलाइज कि हो सकता है। देन वी मेड देम रियलाइज कि पब्लिक इंस्टीट्यूशन ऑल्सो कैन हैव गुड हेल्थ सर्विसेज एट पार विद यू विथ फ्री सर्विसेज, क्योंकि मुंबई में कोविड में किसी का भी 1 रुपया गवर्नमेंट ने चार्ज नहीं किया। Now this mental health support is legal measure. Now tell me हमारे पीपी कितने अच्छे हैं हर गवर्नमेंट के पब्लिक प्रोसिक्यूटर. मैं तो हफ्ते में 2 बार जाता हूँ. लास्ट 25 ईयर्स मेरे कोर्ट तो इतने हो गए कि नाउ एट दिस स्टेज वो सीनियर काउंसिल भी मेरा क्रॉस नहीं करता. हमारे जो पब्लिक प्रोसिक्यूटर्स है एक्सेप्ट स्पेशल प्रोसिक्यूटर्स वो कितना आपके लिए वहाँ ऑब्जेक्शन लेते हैं सच में बताओ. यू आर इन योर विटनेस बॉक्स, बराबर. वो क्रॉस में आपको गंदगी बक रहा है, आपकी औकात निकाल रहा है, आप डॉक्टर हो क्या आपको ये नहीं आता वो नहीं आता ब्ला ब्ला ब्ला. हाउ मेनी टाइम्स दिस पीपी stood for you and objected to the honorable court. You warned this defense counsel he has no right to go on personal dignity of any of these doctors. They are expert as per Indian Evidence Act. आप बताओ क्योंकि 95% ऑफ पब्लिक प्रोसिक्यूटर जिसका बिजनेस नहीं चलता वो नौकरी करते. आर वी गेटिंग ए गुड क्वालिटी लीगल बैकअप? आई वुड से नो. मैं मेरा एक बता सकता हूँ. एमसीआई एक मैटर था, कुछ एक्शन होने वाला था. मेरे बीएमसी के लोग बोले वी विल प्रोवाइड यू काउंसिल. में बोला माफ़ कर दो, मैं मेरा खर्चा करके सीनियर काउंसिल लगा देता. रियली, क्योंकि दे आर नॉट कॉम्पिटेंट एंड स्किलफुल. और कोर्ट में क्या होता है कि इट डिपेंड्स ऑन हाउ यू प्रेजेंट योर लॉयर. जज ये देखता है कि व्हाट इज एविडेंस ऑन रिकॉर्ड. जज ये नहीं देखता है डॉक्टर डेरे ने कितना काम किया या आप लोगों ने कितनी अच्छी मेहनत की. सो वी आर लैकिंग दिस लीगल मेजर्स. नाउ करंट सीन विल जस्ट डिस्कस. ये मार्ड डॉक्टर ऑन स्ट्राइक, ये महाराष्ट्र के मार्ड डॉक्टर्स, हर स्टेट में है रेसिडेंट डॉक्टर एसोसिएशन. तो वो जाते हैं, डोंट वांट चिल्ड्रन टू एंटर मेडिकल प्रोफेशन. ये देखो एक मुंबई के डॉक्टर ने बोला है कि उसके बच्चों को दिस ही वॉज अफेक्टेड डॉक्टर एंड उसको इतना बैडली थ्रैश किया विदाउट अ फॉल्ट ऑफ हिम कि ही मेड ए स्टेटमेंट इन प्रेस कि मैं ज़िंदगी में मेरे बच्चों को कभी डॉक्टर नहीं बनाऊंगा. सी दिस इज़ वेयर वी स्टैंड नाउ. क्योंकि मैं भी डॉक्टर हूँ, मेरे बच्चे भी डॉक्टर होके अगर मार ही खाना है तो इससे अच्छा मैं मेरे बच्चों को पॉलिटिशियन क्यों नहीं बनाऊँ. पैसे भी कमा लूँगा, 2-4 केसेस हो गए तो क्या फ़र्क पड़ता है. मार तो नहीं खाएंगे ना, मारेंगे हम दूसरों को. सो दिस इज वेयर वी स्टैंड. सम की फैक्टर्स, वायलेंस अगेंस्ट, लैक ऑफ ट्रस्ट, वी हैव डिस्कस्ड. ओवर क्राउडेड, वी हैव कल्चरल फैक्टर्स. ये कल्चरल फैक्टर्स भी वेरी इंपॉर्टेंट है. वाई मीन्स एवरी स्टेट में, हर रीजन में, जैसा राजस्थान में, जैसा वी से बीमारू स्टेट्स, हमारे भी यहाँ ट्राइबल एरिया में, दे हैव देयर सम cultural traditions based on tribes, caste, community, subcaste, से खाप पंचायत, देश पंचायत. they have their own way of medical treatment and समझ होती हो नहीं. अगर प्रेग्नेंट लेडी है तो डॉक्टर्स को ये नहीं करना चाहिए. एंड मेडिकल लाइन में इफ़ यू डू दैट दे विल स्टार्ट फाइटिंग विद यू. हमारे समाज में ऐसा नहीं चलता. डॉक्टर ये क्या कर रहा है तू. तो ये कल्चरल फैक्टर्स है. Inadequate, we have seen this docs under attack. Over 75% of doctors across the country are reported to have faced at least some form of violence. Not only physical, some form of. It may be verbal, it may be psychological also. Escorts committed violence. Doctors have been demanding central law with stringent provisions. Around 18 states in the country already have such laws in place. महाराष्ट्र में भी है नॉन बेलेबल, बट एक पे भी फाइल नॉन बेलेबल नहीं होता है. बिकॉज पब्लिक प्रेशर, व्हेन देयर इज ए पब्लिक प्रेशर, पॉलिटिशियंस विल ऑलवेज सपोर्ट देम. वोट बेस होता है उनका. इसमें भी इसमा है महाराष्ट्र में. सेक्शंस आर नॉन बेलेबल बट अरेस्ट अंडर वीकर सेक्शंस दे आर अरेस्टेड. 324, 323, 326. बस एक बार एक दिन जाते, जज के सामने खड़े रहते, बेल बॉन्ड हो जाता है, घर निकल आ जाते. ये भी हमने ब्रूटल ट्रीटमेंट. हियर आर सम रिसेंट इन वन. एक पेशेंट हु हैड बीन एडमिटेड टू आईसीयू एट लेट काशीनाथ पाटिल हॉस्पिटल इन नारपोली भिवंडी attacked the staffer and damaged hospital after the doctor told his relative to wait outside. ये भिवंडी हमारा लोकल Nazdik area है भिवंडी, near to Mumbai. Just that doctor said to wait for some time. उसने उसका हॉस्पिटल ही तोड़ दिया. See the way we are treated now. So there are many such incident. How to prevent? इसके लिए कोई गवर्नमेंट ने अभी तक पॉलिसी नहीं बनाई. And we all, this is your national organization. I would request Dr. Rajesh Gaikwad, ex-president sir भी है, कि आप national level का आपका organization है. You go to the national ministers and you say we should have a good policy how to prevent violence against doctor. Make a policy, make some good document with some adequate measures and guidelines to doctors also, to police officers also, and to public also. इसमें क्या है? ट्रेनिंग प्रोग्राम, डॉक्टर पेशेंट रिलेशनशिप मीन्स कम्युनिकेशन सिंक, public engagement. See, this what we are lacking. We do not engage public in our hospitals. We should create groups in localities. कुछ अच्छे लोग भी है सिस्टम में. We should create good groups and they should create positivity in that locality. कि जैसे अभी गवर्नमेंट हॉस्पिटल को किसी को पेशेंट को लाना है तो व्हाट पैसे वाले या वेल टू डू व्हाट दे थिंक, अरे नहीं भाई वहाँ मरेगा जाके पेशेंट. सो हमारा इंप्रेशन ये हो चुका है. सो इफ़ यू क्रिएट अ लोकल गुड ग्रुप, हमने भी किसी पेशेंट को अच्छा ट्रीट किया है, हमारे भी पीयर अच्छा है, हर पीआर सबके अच्छे ना फ्रेंड्स होते हैं हमारे लोकल छोटे मोटे लोग. सो यू शुड क्रिएट अ ग्रुप अमॉन्ग्स दी सोसाइटी एंड यू शुड आस्क देम कि थोड़ा हमारा पॉजिटिविटी यू स्प्रेड. जैसे नुक्कड़ पे बैठते हो, चाय पीने बैठते हो रात को, तो बोलो कि नहीं ये गवर्नमेंट हॉस्पिटल अच्छा है, मैं लास्ट टाइम गया था ये डॉक्टर ने मुझे फ्री में इतना अच्छा ट्रीटमेंट दिया, देखो मैं कितना अच्छा हूँ. सो दिस वर्ड ऑफ माउथ in the locality will create a positive environment in this society, and this is really good for this. And collaborative efforts between healthcare institution, government bodies, fast track road. This I would say, if for MCOC they are having a fast track court, for TADA they have a fast track court, for NIA they have a fast track court, for FOXO cases they have a fast track court. Why can't one court of session be dedicated to violence against doctor? See, what is fast track court? They are specially designated court in which there is a mandatory provisions that once the charge sheet has been filed in this court, within 6 months the orders has to be passed. It may go either way. Now your case, a charge sheet is filed, till your completion of trial in session court it will take 10 to 12 years minimum. Till then you are facing the brunt of all this defamation, FIR. हर कोई बोलता रे ये डॉक्टर का तो उस दिन पेशेंट मारा था, इस पे तो FIR फाइल्ड है. See, this way they do. So fast track court is in need of security measures, surveillance cameras. अभी ये हो रहा है, awareness campaign. See, who should awareness? हम लोग सोचते गवर्नमेंट डॉक्टर मेरा काम ही नहीं पब्लिक में जाना, but I would say if you want to be safe you should have your own awareness campaign. जैसे हम लोग when I was in UG, हम लोग जब PSM के पोस्टिंग करते थे, I know through PSM डिपार्टमेंट गांव में वीकली एक बाजार डे होता है, हर जगह होता है वीकली, हर तालुका में एक बाजार डे होता है, वेर उस दिन सारे लोकेलिटी के लोग सब्जी खरीदने कुछ भी आते हैं तो एट दैट टाइम वी यूज टू कंडक्ट कैंप. सो अगर हम अपना, जैसे आप कोई तालुका हेल्थ ऑफिसर है कोई तालुका का तहसील का, अगर आप महीने में एक बार भी वो बाजार डे में आपका टीम लेके वहाँ जाके एक पैंडल बना दोगे एंड अवेयरनेस करो, पैम्पलेट्स दे दो कि हम क्या क्या काम अच्छा करते हैं मेरे PHC में, हम अच्छा सिविल हॉस्पिटल में क्या क्या काम किया है, यू प्रोजेक्ट कि देखो हम कितने अच्छे, गवर्नमेंट कितनी अच्छी है, इवन दो वी आर ट्रीटिंग फ्री ऑफ कॉस्ट. यू क्रिएट पॉजिटिविटी फॉर योर इन दिस. यही बचाएगा आपको. मैडम मार खाने के बाद पुलिस केस होती है, एडवोकेट को पैसा देना होता है 10-10 साल, योर फैमिली इज इन स्ट्रेस, यू आर इन स्ट्रेस, आपकी प्रैक्टिस ख़त्म हो जाती है. आई वुड से सो पुलिस प्रोटेक्शन मिलता है बट नॉट इफेक्टिव. आई वुड से। स्ट्रिक्ट इम्प्लीमेंटेशन ऑफ लॉ ये हो नहीं सकता अपने कंट्री में जब तक मॉब इज देयर। नाउ दिस आर ऑल स्टैट्स वी हैव सीन, इफ यू वांट यू कैन टेक अ फोटो। ऑफिशियल स्टैट्स है ये सारे, whom to blame, IMA क्या किया है, डॉग अंडर अटैक, these are official stats you can take. What are the global perspective? We have shared a photo in which, this was a viral photo on WhatsApp University. Means he is a government doctor only. He is sitting with just, and this is what a good image he is giving to society. See this somewhere, nowadays in corporate, there are some, I did some lectures for G20 summit in Mumbai. I was given a topic of sports, how sports can be useful to prevent drug addiction. थोड़ा मेरा sports, I was a sportsman, उसमें भी मैंने कुछ किया है, and मेरा designer drug पे अच्छा resource है मेरे पास. Even समीर वानखेड़े भी मुझे मिलता है आके. I have that much reach in that area. So minister साहब भी आए थे, and he said कि आपको लेना है. So corporate world, private world, they have started in a छोटा videos बनाते, awareness, videos. स्वाति वो है क्या उस दिन का तेरे पास? दिखा. I will just show you. मेरा एक friend corporate में पुणे में, just see this matters a lot. हमने फर्स्ट वेव में मीन्स काफ़ी लोगों ने थाली बजाने पे पीएम को क्रिटिसाइज़ किया, सब ने किया. वो थाली बजाने से साइंटिफिक कुछ नहीं होता है, बट टू क्रिएट अ मॉरल बूस्टिंग था, वो बाद में इफेक्ट हुआ उसका. दिखाओ स्वाति. आई विल जस्ट शो यू. मेरा एक फ्रेंड है कॉर्पोरेट पुणे में, इज एट बिग पोजीशन. क्या है मेरा है ना कि नहीं, मैं साउंड पे सुनाता हूँ. हाँ. सो हाउ छोटा छोटा वीडियोस, कुछ खर्चा करने की ज़रूरत नहीं. मेरे पास मोबाइल है, आई कैन रिकॉर्ड. नहीं उसका नहीं, तुमको दिया था. इसमें देखो, इसमें हो. सो दैट वी कैन क्रिएट, एंड दिस इज ग्लोबल पर्सपेक्टिव कि व्हाट हैज़ टू बी डन. Now these are various laws we all know. Will not go in section 186, 332, 352 that you can take from slide, or if you want you can take a photo out of that. Section 504, 506, 509, and this is what एक हॉस्पिटल में हम बना के लगाए, रेडी रखना एट द एंट्री पॉइंट, थोड़ा डर दिलाने के लिए पेशेंट को कि आप बदतमीजी मत करो, नहीं तो क्या हो सकता है. मिल गया. सी नाउ आई विल जस्ट एक सुनाता हूँ, मैं दिखा भी इसमें नहीं किया. देखो जस्ट सुन लो. दिस इज वीडियो.
बाकी सब ठीक बस चल रहा है. बाकी सब ठीक बस चल रहा है. बाकी सब ठीक है ना, बस चल रहा है भाई. व्हाट अबाउट यू? हाँ चल रहा है. बाकी सब ठीक बस चल रहा है. बाकी सब ठीक बस चल रहा है. बाकी सब ठीक है ना? हाँ ठीक है. और तेरा बस चल रहा है.
Hardly 25 seconds, but it creates such a good environment and positive feeling for employees and the awareness. This is where see now new rules in doctor, non-bailable, deterrent acts on doctor. So this we all know, and thank you for patient hearing. And over and above this, I will again say कि local taluka areas, please make a dedicated group amongst the healthcare facility. देखो एक बात सोचो, मैं हर बार सोचता हूँ आज मेरे पे नहीं आया तो मैं क्यों बीच में आऊँ. आई विल बी ए गुड स्पेक्टेटर और हंसूंगा, मेरे कलीग को मारा है, मेरा कलीग का पूरा नुकसान हो गया है. बट ऑलवेज कीप दिस इन माइंड, कल आप भी हो सकते हो, मैं भी 10 साल बाद. और अगर सामने वाला भी डॉक्टर यही सोचेगा कि मैंने मार खाया तभी हंस रहा था, अब मैं भी तमाशा देखूंगा कि ये मार खा रहा है, मैं भी एकदम अच्छे से रहूँगा. प्लीज़ हैव यूनिटी इन मेडिकल प्रोफेशन. कुछ नहीं होता, कोई अपना दोस्त ने 2 रुपये अगर ज़्यादा कमाए, किसी ने 2 अच्छा नाम हुआ है, तू अपना दोस्त है, अपना फ्रैटर्निटी है. वननेस इन फ्रैटर्निटी हैज़ टू कम. सी प्रोफेशनल जेलेसी, कौन कितना प्रैक्टिस कर रहा है, कौन कितना बंगले, कितना बड़ा हॉस्पिटल है, वो अपनी मेहनत से कर रहे हैं हर कोई. बट वी शुड नॉट बी जेलस. हमने ये सोचना है कि मेरा अगर एक फ्रेंड मेरे फील्ड में, मेरे मेडिकल लीगल फील्ड में मेरा एक एक्स दोस्त इतना अच्छा नेशनल लेवल पे गया है, तो आई शुड टॉक विद हिम कि भाई मुझे भी ऊपर लेके जा, मुझे भी आप बताओ कि आपने क्या कैसे कैसे व्हाट लैडर, कितनी मेहनत की है, और मुझे आप उंगली दे दो, हाथ मत दो, सहारा दे दो. आई विल वर्क हार्ड एंड मैं भी आने की कोशिश करूँगा. इफ़ वी डेवलप अ एटीट्यूड अराउंड ऑल द रजिस्टर्ड मेडिकल फ्रैटर्निटी, मैं बोलता हूँ 90% आप पे वायलेंस वहीं ख़त्म हो जाएगा. सो थैंक यू वेरी मच. थैंक यू फॉर लिसनिंग.
Thank you so much, Doctor, for the wonderful insight. I request all the dignitaries to please stay back up on the stage. Please stay back up on the stage. First and foremost, I want to thank the chairpersons as well as the speaker. And now I request our former president of AIFGDA, that is Dr. Rajesh Khyali, to please come forward to felicitate our chairpersons. Let's welcome him with a round of applause. I request Rajesh sir
Chairperson.
to please honor our chairpersons. Dr. Kiran Madhale as well as Dr. Nasreen Bharti. Let's hear for both of them.
चलो एटलीस्ट क्लैप तो करिए. फ्रेश हो जाएंगे हम लोग.
Nasreen Bharti. जोरदार तालियां होनी चाहिए. I request everyone to please stay back. अभी मैं चेयरपर्सन से रिक्वेस्ट करूंगी कि हमारे वंडरफुल स्पीकर को, यस, या
किरण सर, सैपलिंग ले लो. ग्रीन वर्ल्ड.
ग्रीन क्लीन डिसिप्लिन. 1 minute.
थैंक यू डॉक्टर राजेश. आपने बहुत अच्छा बोला, वायलेंस अगेंस्ट डॉक्टर्स, एंड वी आर द सफरर. इवन यू डोंट नो, आई लॉस्ट माई हस्बैंड बिकॉज ऑफ दिस वायलेंस. मेरे घर में रॉबरी करने आए मरीज बनकर, मेरी पुरानी 10 साल पुरानी सर्वेंट, और डॉक्टर साहब को बुलाया व्हाट्सएप कॉल करके. डॉक्टर साहब ने लास्ट 4 मरीज देखे, वो चारों रॉबर्स थे. उनको देखा, उनको लिखा है डायरी में, फंडस तक चेक करी. ही वॉज ऑफ्थेल्मोलॉजिस्ट, रिटायर्ड एडिशनल डायरेक्टर ब्लाइंडनेस कंट्रोल. उसके बाद उन पर ब्रूटल ऐसा अटैक किया कि वो मतलब पूरा गला घोटना, नाक दबाना और बाथरूम में बंद कर दिया. उसके बाद वो उनको ARDS हुआ और रेस्पिरेटरी फेलियर, किडनी फेलियर. 38 डेज तक वेदांता में रखा. वी कुडंट सर्वाइव हिम. लास्ट ईयर वो थे अपनी एसोसिएशन में यहाँ पर. डॉक्टर साहब, वी आर द सफरर्स. हम डॉक्टर्स डेफिनेटली बहुत ज़्यादा सफरर हैं. हम सबको यूनिटी बनाकर आगे चलना चाहिए, और ये किसी के भी साथ हो सकता है. ये नहीं कि आज नसरीन भारती के साथ हुआ. Nobody knows who is the next one. Nobody knows. Thank you, Dr. Sir.
We are with you, ma'am.
Yeah, please. Please.
I request now it's time to honor and felicitate the most respected honorable speaker, that is Dr. Rajesh Dhere ji का भी जोरदार तालियों से हम स्वागत करेंगे. And I request the chairperson also to please join in this felicitation ceremony. Green clean discipline. मैं इनकी बात से पूरी तरीके से सहमत हूँ कि आप लोग बहुत ही अच्छे डॉक्टर्स हो, गवर्नमेंट डॉक्टर्स, क्योंकि गवर्नमेंट डॉक्टर्स एक आम आदमी के लिए मसीहा है. वो एक पेशेंट को ठीक करने से पहले नहीं देखते कि वो अमीर है या गरीब है. सो ह्यूज राउंड ऑफ अप्लॉज, अ बिग थैंक यू टू ऑल द गवर्नमेंट डॉक्टर्स.
First of all, I congratulate sir for an excellent talk. Actually, that slides also very great. No other thing to add. I want to give a small idea, because the public health leaders are there here. Yes. Because these are all the legendary leaders all over the country. Just a small suggestion is, if at all anything you want to project an idea to the government or the public, we need to provide the impact of that particular incident. If doctors are at the stake, means there is a huge violence on the doctors. So what is the impact of that violence on the patient services? So that should be
awareness.
The articles should come in that way. Like say for example in district hospitals, if some doctor is at defense side, that case he is supposed to done that at institute,
Yeah.
maybe posted, referred to Hyderabad or nearest metro. So the kind of impact on this, if you doctors are on the defense side, what kind of impact on the patient? If you come out with that statistics in a national level, like you are all having your control over your respective states. So please do that so that we can project that statistics into the government, what a patient will lose if a doctor into the defense side. So please do that. So that will be great help to project this idea. Thank you.
Truly said, that is where we said public awareness. Go into the society. आपके लिए गवर्नमेंट पुलिस नहीं है, हमको हमारे लिए आना है. See, unless and until, see, social media is free. Make groups. Make, if you are in, say, civil hospital, take any state. If I take civil hospital, Mumbai, take example. You can have a social media, free है. Project करो, जैसे sir has said. Project good things about us. लोग नहीं हमारे बारे में गलत बात करें, every day I read something post, कहीं ना कहीं डॉक्टर को गाली, कहीं ना कहीं डॉक्टर को ब्रूचर बोला जाता है, कहीं ना कोई डॉक्टर को लुटेरू बोला जाता है कि बहुत बिल बनाया. See, this is the we have to project for ourselves. So ये जो सर ने बोला है ना कि start projecting your good work, start projecting, make groups. जब तक खुद का काम आप प्रोजेक्ट नहीं करोगे तब तक आपको लोग अच्छा नहीं बोलेंगे. So thank you once more, and I think we should applaud my friend and new president of your association, Dr. Rajesh
Gaikwad.
Where is he? He has gone out. वो busy
Yeah.
है. Anyway. And this is Dr. Abhijit Osmani.
Thank you.
मेरे स्टूडेंट थे, but such a good admin, such a good liaising, I would say, hard work. I would say within, I think 18 to 16 or to 18 days में जितना भी जमावड़ा है आप देख रहे हो, जितना भी जो भी है, we have tried our best, these two people and their team. They have
Thank
tried.
you so much. Thank you so much.
I only supported for CME and all this, liaising, but actual जो ground level coordination है, Dr. Rajesh Gaikwad, Abhijit, really for last 16 days, they are toiling their brains day in and day out. And एक ही बोला था मुझे डॉक्टर राजेश ने, और इसने 15 दिन पहले मिले थे कि सर कुछ भी करके मेरे को इतना अच्छा करना है और अपनों को 5 स्टार में ही करना है. तो दिस यूनिट इज 7 स्टार and is one of the reputed hotel of our country, and we hope that you will have a very good time in Mumbai, and we all are there for you. You all are our guest, और जैसे हम कहते अतिथि देवो भव, you all are God to all our people in Maharashtra.
Lovely. Thank you so much. I'm sure जब डॉक्टर राजेश स्टेज पे होते हैं तो बहुत सारे डाउट्स भी आते हैं. ड्यू टू टाइम कंस्ट्रेंट वी विल कंटिन्यू दिस लेटर. और भी कुछ भी जो आपके मन में सवाल है या कुछ भी है, your questions, your doubts are valuable to us. We can take it forward during the networking lunch. Now we move forward towards the second session, that is the importance of documentation in medical practice. First and foremost, I would like to invite our chairperson to please come forward and kindly be seated up on the dais. So ladies and gentlemen, put your hands together for our former president, AIFGDA, Dr. Rajesh Kalia. Come on, जोरदार तालियों से हम उनको एक बार फिर से बुलाएंगे मंच पर. Next, he is MS Ortho, MCH Ortho, Maharashtra Government Medical Officer Association State Coordinator, District President, that is Dr. Asif Saudagar. Another chairperson, we request him to kindly join us on a dais. जोरदार तालियों से हम Dr. Asif Saudagar को हम invite कर रहे हैं. Okay. And yes, it's time to invite our honorable speaker. He's the additional professor. Also, he's a department of the, forensic medicines. He is also L&T, that is Lokmanya Tilak Municipal Medical College. He is also the treasurer of MLAM. So, you ladies and gentlemen, put your hands together. He's going to take us to the importance of the documentations in medical practice. Ladies and gentlemen, it's time to welcome Dr. Hemant Kukre. Come on, जोरदार तालियों से इनका स्वागत करेंगे. I request Asif sir also to please join in. Asif Saudagar. Let's welcome him also. MS Ortho, MCH Ortho, Maharashtra Government Medical Officer Association, State Coordinator, District President. सारे रिस्पेक्टेड डॉक्टर्स के लिए जोरदार तालियां उठाएं प्लीज.
So good morning everybody. Myself Dr. Hemant Kukre, additional professor at Lokmanya Tilak Municipal Medical College and Sion Hospital, Mumbai. And I am also working as a treasurer for Medical Association of Maharashtra. As our host said, and public perception is that God does not treat everyone, does not able to take care of everyone. So He sent us as an angel to treat the people. But this angel needs to do the work in addition to treating the patient. That is the work of documentation. So by the end of this session, we will be able to see what is documentation, understand the importance of documentation, identify the purpose of documentation, recognize the principles, in general terms, differentiate between different types of data, and what is quality documentation. So, basically documentation is a written paper that contains something original, official, or legal form of something that can be used as a evidence of information. What is medical documentation? Medical documentation is a written form by a doctor or clinician. Those are licensed to practice. Now, because this is what is important is doctor should provide whatever data that is written it accurately and completely. Medical record is a communication amongst the healthcare provider, a record that is kept solely because legal significance, and improper or biased documentation hurt the medical practice as such. Medical records are the one of the prime source of information or evidence in the court of law, and in criminal as well as civil court it is used as a evidence. So improper recording or documentation will hamper justice to the people at large and to the doctor in cases of or in charges of negligence. Accurate and legible entries are mandatory for appropriate patient management, continuity of the care, coding, procedures, and appropriate risk management. Documentation of patient evaluation and treatment must be completed at the time of service is performed. Medical record you prepare today may be reviewed by everyone. Accuracy and completeness may be questioned and scrutinized at every stage whenever it is reviewed by other persons. It is required for the protection of medical personnel. It indicates continuity of the care and promote patient safety, provide written evidence of care provided, intervention or interactions. It is source of information for risk identification and quality improvement. It is essential for coding. It may be best defense if suit is filed against the doctor. Now, what is the purpose of documentation? Prepare basic information of the patient, it justifies the treatment, whatever treatment you are given. It is justified if it is properly written, if it is properly documented. It allowed the continuity of the care, particularly when you are dealing in a hospital where there are multiple specialists or multiple units are working. And if everything is documented properly, then it will help subsequent doctor or subsequent in-charge doctor to continue the care without fumbling. Satisfy regulatory requirement. It is regulatory requirement that is prescribed by the law that you should prepare patient's record properly, provide data for quality control and research. This data is subsequently scrutinized to see where there is something wrong, and it will help to control that wrong and improvement. Is documentary evidence for evaluation, treatment and change in condition if required. Communication tool between the clinicians. Clinician can share data and it will help to enhance their knowledge. Now, what are the general principles? Medical record should be complete and legible. Documentation of each patient should include chip complaints, history, then physical examination finding in details, prior diagnostic test, assessment, clinical impression and or diagnosis, plan for care, date and verifiable legible identity of the health care professional who provide the services. It is important. If not specifically documented, the rationale for ordering the diagnostic and other ancillary services should not be able to easily inferred. To the greatest extent possible, past and present diagnosis and conditions should be accessible to the treating or consulting physician. Appropriate health risk factors should be identified. Patient progress, response to and change in the treatment, planned follow-up and instruction and diagnosis should be documented. Then ICD-9 classification, addendum to the medical record should be dated and day the information is added should be written properly. Services should be documented during or as soon as practicable after it is provided in order to maintain the accurate medical record. Confidentiality of the medical record should be fully maintained, consistent with the requirement of the medical ethics and law. Now, what is good medical record? Good medical record documentation or record is prepared timely. It should be accurate. It should be complete. There should not be any omission. Legible. It should not happen that आप लिख रहे हो और कोई भी नहीं पढ़ रहा है, शायद आप भी नहीं पढ़ रहे हो. Free of extraneous information, not necessary information should not be included. That is not what you feel it is not required should not be included in the treatment record. Objective, whatever you see, whatever you observe, whatever you examine should be included only in the treatment record and not the hearsay evidence given by the or hearsay information given by the relative. It should be comprehensive. It should be signed, timed and dated. Every entry must be timed, every entry must be signed and every entry must be dated with proper date and time. Now, what is poor medical record? Poor medical record is blaming or accusatory in nature. It is stated with innuendo, no one knows who has written it. It is incomplete, it is inconsistent, falsified and illegible. Now, what is accurate, complete record? What is the importance? Okay. There is a request from organizer that ministers, honorable minister will be joining at 12:10 online to this session. So everyone is requested to remain seated in the hall and not to leave the hall. So coming to the documentation. Now, accurate, complete and eligible medical record implies that it is accurate, complete, organized assessment and management of the patient is followed. What is accurate? Accurate means documents, facts and observation only. Whatever you observe, that should be written. Do not speculate about the patient or incident. Whatever given in the history, whatever told by the patient or relative should be writing as it is. Do not speculate, do not assume. Double check the numerical entry. Whatever you have written before completing, before concluding, double check with persons, locations and medical terms. Now, to err is human nature. What happens if you make some mistake? Tear off the document and then again reattach it. Rather than doing that, document it. So, rather than finding by other people. अगर आपको गलती हुई है तो बेटर वे यू करेक्ट इट. अगर किसी ने दूसरे ने पकड़ लिया तो प्रॉब्लम हो सकता है. Now, how to correct entries in the medical record? Just draw a single line. Do not scratch off everything that no one is able to read it. Just draw a single line so that whatever written is very well legible and can be read by other person whenever that document is being scrutinized. It indicates your honesty with your work. Date and initial the correction. Whatever correction you made, just sign it, date it and possible time it. Add a note regarding correction. You can add a note if you think so that it is necessary to be done, and it will help it indicate your honesty with the work. Enter the corrected statement in chronological order, not haphazardly. Include all requested information. If information requested does not apply, note not applicable. Do not leave any blank space if you are particularly filling pro formas. Then if it is not applicable, write it not applicable. If you leave it blank, then someone make the entry and it may be difficult for you to assess whether that entry is made by me or not. If you look for something and it isn't there, document it. Negative history should be, or negative finding can be written. Failure to document implies failure to consider. Specific information given to the patient. Then list any handouts by name that you give to the patient. You give information to the patient and you do not document it, indicate that you have not given information to the patient. Particularly when you are obtaining consent, you are giving information to patient in the form of any documented or written article, then you document it in while writing the notes so that it indicates that you have given proper information to the patient. Document patient understanding of instruction, information, etc., such as patient verbalized understanding. Now, whatever patient response or response of the relative, you should document it whether they understood it or not. If you have explained it verbally, then in what language you have explained it, it should be documented. Documenting the patient understood is not appropriate and is poorly defensible. If you have a long report, doesn't hesitate to use additional seat. अभी जगह नहीं है, मैं कैसा लिखूं? That should not happen. You can add additional seat as long as you want it or you require it. But complete documentation is must. As far as documentation is concerned, if you have not documented, it indicates you have not done it. What is legible? If you cannot read the report, you may be unable to determine what happened. Whatever you have written, if you are not able to read it, then it is difficult for you to remember what has happened at that time. Again, well legible documentation indicates it speak for themselves. There is no scrutiny or little scrutiny will be there in cases of legible handwriting. If document cannot be deciphered, illegible documents court may not consider at all. Legible charting is the single most effective way to improve the medical record. Writing legibly requires little or no additional time. When defending malpractice action, an illegible record is of no help. If report is sloppy, other will assume that care will be equally sloppy. Now, this record should be free of extraneous information. Avoid labeling patient, commenting on personal attire, it is drunk or psychic patient. Describe observations you made. You should not write anything that you have not seen. Again, it doesn't mean that negative finding you should not include. If you think that this finding should be present and not observed, you can write it. Prefer the comment made by patient with per the patient or patient stated or the as per history given by allegedly or alleged history given by the patient in the language what he has stated. If he is unable to speak or you unable to understand the language, sign language what you have used, you can write it. A record of hearsay evidence or hearsay things you should include only if you think it is of any help. Do not record hearsay as a fact. Use quotation mark only if the statement is accurate to the word and stated by it as a fact. Avoid interjecting humor to the public. The public does not regard medicine as a funny business. Do not comment or do not make up what we can call comment that indicates you are not serious enough to your work. Now, types of documents. Types of documents that you use will depend on the facility and hospital. Regardless of the types of documents you use, there are several key components. First is objective versus subjective. Now, what is objective documents? It is measurable. What you have done, what you have seen, it is measurable. The examiner's assessment of the finding, it includes results of diagnostic test. It is not judgmental. Whatever happened, you have written it. You see it, you hear, auscultate, smell, whatever that you have done can be included in the objective data. A statement of non-finding may be what lead you to consider the differential diagnosis. Indicate that thorough examination was completed, that you didn't overlook anything. May eliminate the potential for your word against their situation if you find yourself in the court. Subjective data information is received from patient family includes chief complaints, history of patient present illness, history of past illness, systemic review, family and social histories. Now, consent. Informed consent is a dialogue. It is the exchange of information between physician and patient. Purpose is to provide adequate information to the patient so that patient can make informed choice regarding their health care. Informed consent is a process. It is not a paper. Informed consent occurs as the physician discusses with the patient regarding disease diagnosis, proposed treatment with other option, risk and benefit. This implies that the patient is given objective medical information related to their state of health in the language they understand. The patient is allowed to ask questions and have them answer to their satisfaction before making a decision. Now, what is quality of the documentation or quality documentation? Sign your notes. Sign every entry. The habit of signing immediately help you if that document is not signed, that entry is not made by you. Never sign someone else's note. Anyone who has made the entry, do not recognize it, do not authorize it. Countersign the someone else's note only as a verification. Record date and time of all entries, consultation notification, all orders, securing all consent, authorization, releases, all informed consent. Failing to document times implies the lack of concern about the time factor. It will protect yourself. Never alter the medical record. Never skip line or leave blanks. Whenever you are writing, there is a standard spacing between the line and there should not be extra space available for or extra space should be left unattended. Never obliterate. Document with ink only. Do not document with pencil so that it can be rub it off and then subsequent entries is or can be made. Select your word carefully. Selecting your word carefully or thoughtfully is very important. You want to state your document with confidence and without hesitation. Do not use vague word. Avoid using this terminology unintentionally, inadvertently, somehow, unexplainably, unfortunately, and apparently. Maintain physical security of the record, medical record and security. Every record, particularly medical legal documents, must be in the custody of in charge of the hospital or superintendent or nurse of the ward. Never remove record from the facility or the office. Never remove for any reason. If it is being removed, only with the authorized personnel, particularly when it is required to be transported in cases of court call or some authorities demanding in such situation, only authorized person should be allowed to handle the documents. No unauthorized copying of the record. No access to the record by unauthorized individual. In summary, remember, poor documentation makes good care look bad. Good documentation may be your best defense in an allegation of the negligence. In conclusion, as a responsibility grows, so does the accountability. There are few, if any, profession that bear more responsibility than the medical profession. With this huge responsibility, there is a strict accountability. What does this accountability mean? It means the proper documentation and record keeping can be as important as providing proper care. One of the philosopher said, single biggest problem in the communication is illusion that it has taken place. So communication that is not written is of vain or useless as far as medical documentation or medical practice is concerned. So better be safe than the sorry. Thank you.
Thank you, sir. There is one question from my side. The medical legal papers, how many years we should keep with us?
Medical legal papers, we can classify it into OPD papers, IPD papers, and data that is required to be kept for life. So OPD papers up to 3 years we can preserve, IPD papers 10 years, medical legal documents that is related with the criminal cases, till that cases is finalized by the court of law, you can preserve it. Records like death certificates, then post-mortem reports, birth certificate has to be kept for life.
Thank you, sir, for your informative and knowledgeable session. And I would like to ask you from the auditorium, can you give a take-home message for keeping documentation hassle-free? There is some few tips.
Yes, as far as our what we can call the technology is advancing. So we can just record whatever we are doing with the patient. And while recording, you can put notice in your OPD or in your consultation that you are recording this. Again, recording whatever document you are preparing, you can keep the photocopy of each and every document so that it will not increase your burden as a physical documentation. A soft copy will be available with you for every time.
Thank you, sir.
Thank you.
Thank you. Any questions from auditorium? Thank you.
Thank you so much, sir, for the wonderful session. We have with us one of the most respected dignitary, our Joint Secretary, Lahani sir. Let's welcome him with a huge round of applause on behalf of Government Public Health Department, Government of Maharashtra. So thank you so much for your presence today. Now I request Dr. Jyotsna Ranga to please come forward. Dr. Jyotsna, please come forward. Let's welcome her with a round of applause, and I request you to let's felicitate our chairpersons and the speakers. It was a great session, a very knowledgeable, a fruitful session it was. I request you to let's honor and felicitate our chairperson. Thank you so much, Dr. Rajesh, for your time. It's time to honor Dr. Asif Saudagar. Sir, thank you so much for your presence. And yes, a very wonderful speaker, Dr. Heman Kukre. जोरदार तालियां होनी चाहिए उनके लिए भी. I request all of you to please stay back. Yeah, speaker. Oh. I request the chairpersons also to please join in honoring the speaker with a memento and an amazing sapling. And our humble request, I request everyone kindly be seated as we have our dignitary, Honorable Health Minister will be joining us shortly. Thank you. Thank you all of you. Kindly be seated back. So yes, the most awaited moment has arrived. It's time to have a one-on-one, conversation and have a complete with the Honorable Health Minister. He'll be joining us shortly. But before that, it's time to call upon our Senior Vice President of AIFGDA, that is Dr. Madhav Hassani, sir, to please come forward. Let's welcome our Senior Vice President. जोरदार तालियों से हम उनका स्वागत करेंगे. Sir, I request you to please come forward and address the gathering with a welcome note.
मीटिंग चालू हो गया क्योंकि मुझे वेलकम नोट जब मंत्री जी हैं उनके सामने बोली.
अच्छा, मुझे बोला गया था कि आपका भी बुलाना. टाइम क्या हुआ है?
3
हाँ, तो कितने बजे भी चालू होगा? 12:15. ठीक है, तो मैं टाइम पास करती हूँ. आप ऐसे सेटिंग वेटिंग कीजिए थोड़ी यहाँ पे ऐसी, है ना? ठीक है.
ठीक. Thank you, dear friends. As I want to inform you that I have been allotted the work of welcoming Honorable Health Minister and SCS sir. So we have to wait for a little bit. They are joining us online. I think you have got 2 good sessions about medical record keeping and violence against doctors, and as far as speakers are concerned, I think they have worked hard in their whole life and one who has worked, who can only tell us about the real experience, what is going on. This is not the lectures of other colleges, like one can read and issue a lecture. This is a real lifetime experience in medical field. When you work and work, you get experience, and only after that you can communicate in such a nice way. So I especially thank Dr. Dere sir and team for their good sessions on violence against medical fraternity, paramedics, medical institutions. Also, I would like to honor our President, Dr. Rajesh Khayalia, and our General Secretary, Dr. Ranjit Kumar sir. So let us start with So let us start with our senior members and office bearers. Dr. Rajesh Khayalia sir, please do join us on the stage. Dr. Ranjit Kumar sir, our Secretary General. Dr. Pramod Tiwari sir, Dr. Helaiya sir, Dr. Ajay Chaudhary, Dr. Dere sir, Dr. Rajesh Gaikwad sir, Dr. Sachin Vesh sir, I request Dr. Rajesh Gaikwad sir. Please sir, come on stage. Actually, this was not formally designed as per our programs, but due to these online issues, we have to wait for few more minutes.
Thank you so much, sir.
Yeah.
Yes, sir. Okay, yes, once again we have a
Not
wonderful
off topic.
speaker.
You know,
Dere sir is back.
is on.
Yes, sir.
So we'll wait for minister. Undoubtedly, we always start by Indian standards. So time आगे पीछे होता है. But what I feel, I should mention this all CME. What program and everything we did in 8 days, and I should tell you that my department staff, this Dr. Hemant Kukde is my next professor. He has planned all this CME within 2 days, all topics, everything. Then Dr. Sachin Patil, Dr. Naren Kumar, and one forensic odontologist we have. So these all 4 people have planned this CME. I only licensed for hotel and management of offices. So I think I request you to give them a round of applause for their such excellent work in academics. And I will tell you, our department has only 4 faculties. I'll just brief our department, and we do maximum medical legal work in Mumbai. मीन्स ऐसा कहा जाए 3 मेडिकल कॉलेज का एक जगह और हमारा एक जगह, फिर भी इन दिस स्टाफ ऑल्सो वी डू ऑल एंटीमॉर्टम केसेस And we get more than 800 POXO and sexual offense cases per annum. So this, chalo हाँ, सरन्या होते. Sir, please, Lani sir, Joint Secretary Health. आप आओ मैडम आओ.
Okay. Before you have, ministers are coming forward, one thing that I really wanted to know, when you hear the word AIFGDA, what is the first thing that comes to your mind? What is the best one thing that comes to your mind? I'm looking for some different answer. When you hear about this association, what is the one thing that comes to your mind? Yes?
One nation, one platform for doctors.
Lovely. One nation, one platform for doctor. Anybody else with some different answers? Come on. आपका नजरिया, आपकी सोच, बताइए. Anybody else? Come on. How about you, sir? वैसे आप क्लिक बहुत अच्छी करते photos.
It is the platform for the doctors for their all the meanings and their ultimately dignities. Yeah.
Lovely. Next, can I have some more answers? Yeah. I request you, once I give you the mic, please अपना नाम जरूर बताइएगा, because today I want to know majority of the more doctors, the respected doctors.
I'm not going to say anything different. As one of our colleagues said, one nation, one platform. It is the unity in diversity. We are working at our places, but we are not united. There should be one such platform to come forward, to put our questions, to come together. So this is the nice opportunity or the nice platform where we can put our problems commonly in front of the nation or the central government.
Good answers. Do keep clapping after every answer. It's really a good thought they could put forward.
Thank you, ma'am. Myself, Dr. Vikas Thakur, General Secretary, Himachal Medical Officers Association. So this is I'm adding up on the previously said. It is a very nice platform to represent our demands from the grassroots level. It will be helping us to involve medical officer from the grassroots level, that is primary health center, and address it at the national level. Because unity at national level is prime importance. At state level, we are giving the strikes, call up the strike and representing them. But we also require a nationwide representations of our certain demands. And this platform will help our grassroots medical officers to unite, and our demands will be addressed at a higher level, and it's a very good platform. Thank you.
Lovely. Anybody with some different answer? Yes.
Myself, Dr. P.P. Shah, President of Jharkhand Health Services Association. This is a good platform for we doctors. और जहाँ तक मेरा कहना है कि जितने भी डॉक्टर्स हैं उनके कॉमन प्रॉब्लम्स हैं, और इस कॉमन प्रॉब्लम से निपटने के लिए ये हम लोगों के लिए सबसे बढ़िया प्लेटफॉर्म है. इसलिए मैं ये कहूँगा कि वन नेशन, वन डॉक्टर फैसिलिटीज़ एंड गिव facility to all doctors in the same way which is providing to the central government doctor and other state doctors.
Good morning to everyone. I am Dr. Komling Parme. I am President of Arunachal Pradesh Doctors Association. Well, you may not like it, but I happen to come across this All India Federation of Government Doctors Association some couple of months back only. So what I'm trying to say is that why can't this AIFGDA become equivalent as vibrant as IMA? I think that is the need of the hour. We need to strengthen this All India Federation of Government Doctors Association. Thank you.
Hello, sir. Ji, Sat Shri Akal.
Myself, Dr. Jagjit from Punjab. I represent Specialist Doctor Association. So मुंबई आए तो बॉलीवुड का तड़का ना लगाया. AIFGDA मेरे लिए तो जैसे मुंबई का को है कि इस रंग बिरंगी दुनिया में इंसान की नीयत ठीक नहीं. तो इस रंग बिरंगे देश में डॉक्टरों की हालत, खास करके इन सर्विस डॉक्टरों की हालत ठीक नहीं. दैट इज़ वाई AIFGDA जिंदाबाद.
Wow, sir, lovely answer. Full on Punjabi वाला था तड़का.
Actually, the moment I saw the AIFGDA, that tagline is anything has a tagline as a value, committed to the healthcare. So in the same way, whether you accept or not, the government doctors of India are the face of health in India. They are the real agents for the change in the country. Whereas AIFGDA is a spine of that change. So, like same thing.
Lovely answers, lovely answers. I'm sure we all are carrying a mobile phone, right? Yeah, I'll definitely come to you, sir. Okay, so now, yes.
Actually, the mic was given at the very hurried time at that time, so I could not give you some of the best answer to these things. We can say it is a software. Yeah, it's just like a software that is ultimately utilized by the users. We are all the users, and ultimately we need some sort of the solutions of some things, and that things will be obtained by this wonderful AIFGDA, All India Federation of the Government Doctors. So I think that is the good software for all of us. You know, this is the time of the technology, and we need some of the people, they are just working for the interface, and the interface is required for the documentation and for the purpose of to connect with the other other institutions. So it might be the good software for all of us.
Lovely answer. With this, the last answer, then we move on towards the next session. Yes. Hello, sir. How are you?
I'm fine. Myself, Dr. Asif Saudagar. On this AIFGDA platform, I would like to request, just like soldiers, one rank, one pay, even government doctors can ask one rank, one pay, just like medical officers, professors in both streams, we can ask for nationwide same pay band or same pay scale. Just Dr. Rajesh Gaikwad and Rajesh sir, please put in light on this issue. Thank you.
So thank you so much. So as I hand over once again to Hassani, for that, today's day is very, very memorable day as we have doctors all over India coming together. As I say, 3, 2, 1, you all have to pull up your phone, start up a picture or a selfie mode, whichever you are comfortable. Do click a picture. All of you will click a picture together. और आप कहीं भी post कीजिएगा. Do tag us so that everybody is together. You know, if you not as an Insta @AIFGDA, if you type out on Facebook, hashtag 3. Everyone remove your phone. Come on, let's click a picture. You can also click with the backdrop anyway. 3, 2, 1. Everyone, let's have a picture. Come on, let's have a picture. Welcome to the family. Hashtag AIFGDA. @AIFGDA. Come on, everyone, let's have a picture together. Say, come on, मेरे साथ बोलो, cheese. Come on. I know हम सब डाइट पर हैं, लेकिन अभी सब एक साथ बोलेंगे cheese. Come on. Do tag us. With this, I hand over the mic to our respected Hassani sir. Yes, Madhavji.
Dear friends, we are having very much issues related with our organizational issues, which will be discussed after formal inauguration of our AIFGDA General Council meeting. And at present, we are attending this national CME on violence against doctors. After that, definitely we will try to have a national act regarding violence against doctors, at least 7 to 10 years of imprisonment, so that this offense must be a non-bailable offense, and people must retaliate themselves from any such act of violence against doctors or medical institutions. So I am as instructed by our Honorable Organizing Chairman Dr. Rajesh Gaikwad sir, I will like to welcome Dr. Tanaji Rao Sawant sir, Honorable Health Minister of Maharashtra, Mr. Milind Maheskar, ACS Public Health Maharashtra, Mr. Vijay Kumar Rane, Joint Secretary Public Health State Maharashtra, Dr. Rajesh Dere, Professor and HOD, Sion Medical College, Forensic Medicine and Toxicology Department with his team, Dr. Rajesh Khayalia, President, All India Federation of Government Doctors Association, Dr. Ranjit Kumar, Secretary General, All India Federation of Government Doctors Associations, all senior members of All India Federation of Government Doctors Association, and office bearers of all member associations present from various states across the India for this memorable event of General Council meeting and a national CME on violence against doctors. I again welcome you all delegates and Honorable Minister sir. I would like Honorable Minister sir to inaugurate formally this event. Please. कुछ नहीं बोलना, ठीक है, ठीक ठीक जी
सेक्रेटरी ज्वाइन हो गए, एसीएस ज्वाइन हो गए, वेलकम.
Our ACS sir, Mr. Milind sir has joined.
So as you can all see, Additional Chief Secretary, Government of Maharashtra, Shri Milind Maheskar, he has joined. So let's welcome him with a round of applause. He can hear us. जीतू, वो जो स्क्रीन है उसका ऑडियो हम और थोड़ा वो लाउड कर देंगे बड़ी. थैंक यू. यस,
आभारी आहे, आवरा लवकर.
As we can all see, Dr. Milind Maheskar is right here. Sir, sir, heartily welcome.
Thank you very much. Sir, thank you. एसीएस सर नमस्कार, धन्यवाद सर, आपण जॉईन झाला.
धन्यवाद, नमस्कार.
Yes sir. Sir, we need your blessing sir.
मिनिस्टर अभी 2 मिनट में ज्वाइन हो जाएंगे. लाईट ह्या इथली लाईट जरा कमी करायला सांग सिया सिया आप कंट्रोल करके वेलकम करके सर को दो सर बाद में चालू करेंगे वेलकम आप पहले सिया करो वेलकम ज्वाइन होने सर मिनिस्टर सर ज्वाइन होने के बाद आप वापस से वेलकम से हो है मिक्स क्या है मिक्स सर मिनिस्टर को कोई देखेंगे हम भी नहीं लोग दिख रहे मिक्स से
So everyone be ready?
क्लैप गाना लगाने जो इनॉग्रेशन करेंगे एक आएंगे ना वेलकम बोलेंगे क्लैप करने के बोलो सब बड़ा कैसे आएंगे वेलकम आप पहले वेलकम बोले तो मैं आगे
Come on, जोरदार तालियां. Dr. Tanajirao Sawant, Honorable Health Minister of Maharashtra. So hearty welcome to you on behalf of AIFGDA. इनसे ज्यादा हमारी तालियों की गड़गड़ाहट की बात ही कुछ और होगी. कम ऑन, एक जोरदार तालियां होनी चाहिए. कैन यू हैव द लाइट्स प्लीज?
डियर फ्रेंड्स,
ऑडियन्सची लाईट चालू ठेवा ऑडियन्सची.
dear friends, it gives me immense pleasure to welcome Dr. Tanajirao Sawant sir, Honorable Health Minister, Maharashtra State, Mr. Milind Maheskar, SCS sir, Public Health Department, Government of Maharashtra, Mr. Vijay Kumar Rahane, Joint Secretary, Public Health, Government of Maharashtra, Dr. Rajesh Dere sir, Professor and HOD, Science Medical College, Forensic Medicine and Toxicology Department, Dr. Rajesh Khalia, President, All India Federation of Government Doctors Association, Dr. Ranjit Kumar, Secretary General, All India Federation of Government Doctors Association, all senior members of AIFGDA and office bearers of all member associations of our federation from various states across the India who are present during this National CME on Violence Against Doctors and General Council meeting of AIFGDA. I wish you all have enjoyed the event, and again I will welcome with all the dignitaries our Honorable Minister sir and request them to please formally inaugurate the meeting. Thank you.
बटन दे
Come on, इसी के साथ can we have some good music in the background? Three cheers for AIFGDA. Hip hip! Hip hip! Hip hip!
Dear friends, now in a brief session, I would like our Honorable President Dr. Rajesh Khayalia and our Secretary General Dr. Ranjit Kumar sir, please facilitate our newly elected President, Dr. Rajesh Gaikwad from Maharashtra. Please.
Congratulations.
Congratulations, Maharashtra. You have been given responsibility to take care of all government doctors associations across the India for next 2 years in able leadership of Dr. Rajesh Gaikwad sir.
Sir, thank you.
Now, I request our SCS sir, please give 2 words of blessings to all of us. Mr. Maheshkar sir.
Good morning, everybody. Our honorable, respected Professor Dr. Tanajirao Sawant, the visionary minister of our department, my colleague Shri Vijay Lahane, Joint Secretary, my Dr. Rajesh Gaikwad, the President of the Doctors Association, and all my friends who have gathered here for this wonderful occasion. It gives me a great pleasure to welcome all of you and to address you on this occasion. I am very fortunate to have been associated with this sector for a very long while. First, in my capacity as Secretary Medical Education some years back, and now as Additional Chief Secretary Health in Maharashtra. Our Honorable Minister Tanaji Sawant is leading our department with a lot of vision. We have taken a lot of proactive decisions like the universalization of our Mahatma Jyotirao Phule, Jan Arogya Yojana, convergence with the Prime Minister's Jan Arogya Yojana, giving free medical treatment in all the government hospitals. This is one of the major steps, starting the generic medicine shops in all our health institutions. Such very innovative and visionary decisions have been taken in a very short while, and this cannot happen without the help and the proactive support by all our doctor fraternity. In my experience as a Secretary of Medical Education and Principal of Additional Secretary Health, I have always felt that health is basically about doctors. You can have a lot of buildings, you can have a lot of equipment, you can have a lot of medicines. But the spine of the entire health system is the doctors. Because if there is no diagnostic, there is no treatment, then all this infrastructure is of no use. That is why I am very happy to note that we are having the national level CAD today in Mumbai. And I really hope that this will lead to a lot of good exchange about the violence against doctors. I especially congratulate our President, Dr. Rajesh Gaikwad, who has been recently elected as the National President. This is a very proud moment for Maharashtra because he is a doctor from Maharashtra and he is leading the doctors' organization in a very proactive way, in a very positive way. He also tells the doctors to do their duty because, as we call it in Marathi, this is a punya karya. Health department is a punya karya. It's not only a government service, but it is a help and service to the people who are in need, who are sick, who are in need of help. That is why, again, I congratulate Dr. Rajesh Gaikwad, who has been instrumental in organizing a very positive approach in all our doctors. I again thank our Minister, Sawant, who has been here, who has been a motivator for all of us, who is taking various decisions also for the doctors, how to give them more incentives, how to incentivize doctors to work in the remote and hilly areas of Maharashtra. And I again thank you all for inviting me for this very, very important and momentous conference of yours. Thank you very much.
Thank you very much, sir. Your able leadership will definitely progress Maharashtra public health services towards better and better patient care and preventive care. Thank you very much. Now, I would like to inform you all that, dear sir, there are 24 states present in person, and 2 states are online attending our this national meet of AIFGDA General Council meeting and National CME on violence against doctors. Now, I request our dynamic leader, Dr. Tanaji Rao Sawant sir, Honorable Health Minister, Maharashtra State, to please say few words about appreciation and our leading us in front from Maharashtra State. And we would like that in the presence of so many delegates from various states, your words will definitely encourage us to do better and better work for public health. Thank you.
First of all, welcome all the doctors all over India, in my state, Maharashtra. And all other supporting staff, whoever gathered for this memorable ceremony, very warm welcome to you all from the bottom of my heart. It gives me immense pleasure to participate in this such great conference of Board of Directors delegations of the All India Federation of Government Doctors Association organized at Mumbai. Again, heartily welcome at Mumbai. Would like to convey my best wishes to the organizer of this great meet for the implementation of health policies, government-related schemes, medical fraternity, which is the best evident with the presence of delegates more than 25 states across the India and 2 are online. It is great to know that All India Federation Government Doctors Association collaborate with the Department of Forensic Medicine, Lokmanya Tilak Municipal Medical College, Sai Mumbai, has been organized a national seminar on violence against doctors and related medical legal issues. I am really worried that violence against doctors has been increasing in the entire country. Myself and my government unanimously condemn any such incidences of violences against doctors. Medics, healthcare institutes anywhere in the country, we think that this should be stopped immediately. Appropriate legal and administrative measures must be taken so that doctors and health workers safely and fearlessly render their services to the society. I convey the message to the entire medical fraternity of the country in your fight against violence. Dear friends, you all are aware that I got this opportunity of Public Health Minister of the entire Maharashtra Public Health Department as a Cabinet Minister in Maharashtra 1 back ago. I would like to share very proudly with you all that our government's achievement in public health sectors since I have been chair. Below are some important achievements done by our government. Mahatma Jyotirao Phule Jan Arogya Yojana, say it was 1.5 lakhs, now it is up to 5 lakhs per person. Asha Workers Monthly incentive increased from 1,500 rupees to near about 7,000 rupees. Mata Surakshit, the Ghar Surakshit, implemented successfully across the state under the campaigning 4.39 crores. And it is examined, created out of which 27.17 lakhs pregnant women. Cataract-free Maharashtra Abhiyan launched decision to purchase 1756 ambulances with advanced medical equipment taken. Decision to establish mental hospital in Thane and Kolhapur with advanced treatment facilities. Jagruk Balak Sudhrud Balak, that Abhiyan starts say from KG to college level, 12th level, say below 18 years, male and females. Among this, 2.92 crores children have been created and the support of medical is already given. Then, Vandaniya Balasaheb Thackeray Arogya Ratna Award started from this year for those who are doing excellent work in the health. proposed de-addiction centers at Jalna, Bhiwandi, Pune, and Nagpur will start functioning soon. 43 points program implemented started in Melgha for control and prevention of malnutrition in children. New cataract lab has been proposed. Then Hindu Hruday Samrat Balasaheb Thackeray Apna Davakhana scheme for urban health. This scheme is implemented since 2023 for next 5 years. Now at this stage, near about we have opened 500 such type of hospitals, means OPD at each and every rural area, taluka places, say at slum areas. To achieve the aim of Digital India in Maharashtra, 3 crore Aadhaar cards generated till the date. Mobile multi-speciality unit, so Niti Aayog project started functioning in Dharachiv, Maharashtra. All health services in government health institutes are made free of charge from 15th August 2023. And I would like to inform you, near about 2 to 3 times OPD is upgraded and near about 5 to 6 times the IPD is started in Maharashtra. For new Ayush hospitals started in Maharashtra, budget provision under 15th Finance Commission done of 7,000 crores, of which 500 Hindu Hruday Samrat Balasaheb Thackeray Apna Davakhana started providing services from 1st May 2023. Online transfer process application is developed and implemented for all medical officers and health workers of Group A to Group C for transparency and equity, so nobody would get injustice. Long-awaited health departmental promotions process geared up and implemented without any delay. Medical Procurement Authority is established by Act on 17th May 2023 to avoid delay in purchase of medicine and medical equipments. It will enhance the transparency in purchase process. Due to my spiritual and holistic approach this year, I do personally plan and monitor all activities during Ashadi Wari 2023 at Pandharpur, that is Arogyachi Wari Pandaricha Dari. This year, many new initiatives implemented during Wari, like Arogyadut, medicine kit for Dindi Pramuk's, Maharogya health camps, Shibir at Pandharpur, Tikrara for ISC different health schemes, and many more to awareness in general community. I feel this is my opportunity, responsibility, and turn to give my 100% for this spiritual cause without any expectation. We serve more than 11,64,000 libraries this year. It gives me immense and satisfaction. I am going to give justice to 2009 Seva Samaveshan medical officers in next few days. It needs support of my department, and I am proud of all these officers. They are supporting me each and every my decision. Then also I am determined to give NPA as per 7th Pay Commission to all medical officers and senior health officers of the health. I am determined pursuing many more dynamic and positive changes in health department with you, well wishes and supports. My dear colleagues, I am very happy to see that you people from all over the country have gathered here discussing among yourselves and making efforts for the betterment of the government health services of the country. You are going to exchange your views and share your experiences regarding your issues and struggle. It will also help you in widening your outlook on national perspectives. I hope and believe firmly that this Mumbai meet is going to add the new dimensions not only to your organization but also to the health services in the public sector, particularly to the poor common people of the country. I am also confident that collective wisdoms of your organization shall help the governments of the states as well as the central government find a way to positively changes in the health indices of the state and the nation respectively. I can assure you that the political leadership in the state or at the national level will always be with you, with your organization for the betterment of the public healthcare in your system. We are determined to safeguard the public sector healthcare healthcare system to protect our medical institutions and workers. Introduction of Indian medical services aiders in the line with ISIP system shall benefit the government as a technical person in the medical field shall take the lead role in formulating and implementing health policies. I will send a suitable proposal from my state to the central government in this regard after discussing with your affiliated organizations in our state. I am also assuring you that I will advocate for your people-friendly demands and take your valid grievances to the appropriate level at the center whenever required. I wish the grand success of your Central General Council meeting and congratulate and the upcoming new leadership in advance, Mr. Rajesh Gaikwad and his team. Best wishes in future in the benefit of our society, in the benefit of Maharashtra and in the benefit of nations. Jai Hind, Jai Maharashtra.
Thank you, sir. Thank you for your valuable words and important, inspiring speech.
Let's give a standing ovation. Come on, everyone.
A standing ovation to Dr. Tanaji Rao Sawant, and we express our gratitude this way. Thank you, sir, once again.
The real Tutari team ahead. Come on. Ek zordar taaliyan. Come on. Jai Hind, Jai Maharashtra. Vande Mataram. Jai Hind. Come on, everyone. Vande Thank you.
Please be seated. Thank you, sir, once again. Thank you very much. And so on behalf of the organizing committee and as well as on behalf of the All India Federation of Government Doctors Association, we'd like to thank our ACS Maharashtra, Mr. Milind Maiska sir, for his very important words and inspiring speech. I'll also like to thank Sir Bijoy Rane sir, Joint Secretary, for his physical presence and inspiring physical presence. And a very special thanks once again for Honorable Health Minister, Dr. Professor Tanaji Rao Sawant sir. Thank you, sir. So with this, we would like to end this inaugural session and we'll now move to our delegate session. Thank you.
The committee, our second meeting, please, I'm requesting you to, I'm leaving this meeting.
Thank you, sir. Thank you, sir. Thank you once again.
I request all the respected dignitaries, kindly be seated, please. I request once again Madhav sir to please join me up on the stage.
Sir, before ending this inaugural session, would request Dr. Bijoy Rane sir, so say a few words briefly.
It's time to thank our joint. It's time to honor our Joint Secretary Lahani sir, as he is representing on behalf of Government Public Health Department, Government of Maharashtra. I request the entire team of AIFGDA to please come forward, and it's time to honor Lahani sir. Lahani sir, thank you so much for coming today.
Please. I request our newly elected President sir, Dr. Rajesh Gaikwad sir, to hand over the bouquet to Dr. Bijoy Rane sir.
Very positive officer for us in Maharashtra.
Mr. Lahane is Joint Secretary of Health and he is, we can say, medical officer, friendly officer, always cooperate with each and every medical officer.
Sure.
अभी हम मेरे बगल में बैठे हुए थे, जॉइंट सेक्रेटरी साहब अभी भी बैठे हुए हैं, और जब मैंने इन्हें बतलाया,
Sir, I would like to call upon Dr. Mrs. Ujjwala Patil. Lady Secretary of Maharashtra.
एक मिनट
Or the, come on the dais. Please come. She is Secretary of our Women Doctors Wing of this Maharashtra unit. Please.
मैं ये बतला रहा था कि जब अभी मैंने बतलाया कि बिहार में 2008 से 3 लेयर का जो डायनेमिक एसओपी है जो देश में सीजीएचएस के लिए या सेंट्रल डॉक्टर्स के लिए देय है, और फिर जब चौथा भी डायनेमिक एसओपी चौथा लेवल का भी जब हो गया तो सर बहुत ही काफ़ी जो है इसमें स्वयं बढ़ करके उन्होंने हमसे लिया है कि मुझे ज़रा से देखने दिए क्या है, और मैं इनकी जो है जिस तरीके से इन्होंने इच्छा व्यक्त की कि डॉक्टरों के लिए जो बिहार सहित जो पूरे देश में, और अभी बिहार एक अकेला राज्य है, वैसे दूसरे राज्यों में अलग अलग है, जैसे उत्तर प्रदेश में अलग तरीका है वहाँ देने का, लेकिन बिहार में हूबहू केंद्र की तरह डायनेमिक एसओपी 2018 से में जो हुआ तो ये 2017 से 1/1/17 से वो वास्तविक लाभ, और जिस दिन से डायनेमिक एसओपी चौथा स्तर का लागू हुआ, ये मुझे लगता है कि ये होगा सितंबर 2008 से, उस दिन से इसको नोशनली लाभ दिया गया। सर उन्होंने लिया है, और हम आग्रह करेंगे सर से कि महाराष्ट्र से फिर शुरुआत हो और डायनेमिक एसओपी यहाँ से हो, और पूरे देश में अगर अगला जो है हम लोग चाहेंगे कि पूरे देश में जो हम लोग का एक डिमांड है कि एक तरीके का जो होना चाहिए यूनिफॉर्म पे होना चाहिए, तो महाराष्ट्र जो है बिहार के बाद महाराष्ट्र से लागू हो और पूरे देश में इसकी सुगंध जो है डायनेमिक एसओपी की सारे देश में जाए। और मतलब सारे लोग आप लोग जानते होंगे कि डायनेमिक एसओपी और एसओपी में क्या अंतर है। एसओपी जो हुआ मॉडिफाइड एसओपी, इसमें सिर्फ वित्तीय उन्नयन होता है, और ये डायनेमिक एसओपी में वित्तीय उन्नयन के साथ पदों का भी उन्नयन होता है, और ये पदों का जो उन्नयन होता है वह इन सीटू होता है, जिसके लिए वैकेंसी की कोई आवश्यकता नहीं है। और मैं चाहूँगा आप लोग भी अपने अपने यहाँ वहाँ की सरकारों से बात करें, वहाँ की सरकार जो है, और मुझे लगता है बहुत इस पर खर्च भी नहीं आता है, एक कहीं न कहीं डॉक्टरों को सम्मान देने की बात हुई ये। थैंक यू।
श्योर सर, ऑलरेडी आपने सुना होगा हमारे ऑनरेबल मिनिस्टर ने भी और एडिशनल चीफ सेक्रेटरी हेल्थ इन्होंने भी बोला है कि दे आर गोइंग टू ड्राफ्ट अ पॉलिसी एंड दे विल सेंड टू सेंट्रल गवर्नमेंट टू हैव यूनिफॉर्मिटी इन दिस। ऑलरेडी मिनिस्टर साहब खुद ने, आपने अगर सुना होगा, ऑलरेडी ये सब बोल चुके हैं। अभी डॉक्टर राजेश गायकवाड़ जी महाराष्ट्र से ही है, ही विल टेक गुड फॉलो अप, आप सब हो, और महाराष्ट्र विल सेंड दिस प्रपोजल टू सेंट्रल गवर्नमेंट श्योरली। वी आर पॉजिटिव ऑन दिस।
चेयर है
श्रेया जी को, हाँ ठीक है, और किसी को?
Okay, it's time to felicitate all our respected dignitaries. Sani sir to please join in. I request Sani sir to please join in.
लिस्ट दो ना, लिस्ट दो ना, फैसिलिटी करना है, इनको नाम दो ना। मैं
It's time to honor and facilitate former president, that is Dr. Rajesh Khiala. जोरदार तालियां होनी चाहिए, and I request our new president, Dr. Rajesh Gaikwad, to please come forward and honor him with a memento. Sir, thank you so much for all your efforts towards the firm.
So it's a precious moment for us as the outgoing and incoming secretaries are handing over bouquets and standing together. Next will facilitate our Secretary General Dr. Ranjit Kumar sir request our newly elected President, sir, Dr. Rajesh Gaikwad, sir, to hand over the bouquet to Dr. Rajit Kumar, sir, please. Sir, please.
जोरदार तालियां होनी चाहिए.
Sir, now we'll felicitate Dr. Helaiya, sir, please. DK Helaiya, sir, please, sir.
नहीं हो गया हमारा हमारा हो गया
बाकी लोग हाँ
बाकी लोगों को खाली
I request our former President, Dr. Rajesh Kyala, to please come forward
Yes,
and
sir,
honor
please.
him. Come on, तालियों की गड़गड़ाहट सुनती रहनी चाहिए. I request Dr. Rajesh Kyala to please wait back, and now it's time to honor.
Dr. Ajay Chaudhary, sir, please.
Please come forward, sir.
Dr. Ajay Chaudhary, sir, please.
Now, I would like our organizing secretary, Dr. Subarna Goswami, to please facilitate our guests, starting from Dr. Dere, sir, Professor Dere, sir.
A wonderful, wonderful personality. जिनके पास नॉलेज का खजाना है मुझे लगता है.
Dr. Pramod Tiwari, sir, from Chhattisgarh.
Welcome, sir. Thank you so much for joining today.
Dr. Sachin Vesh, sir, from Uttar Pradesh. Our organizing secretary, Dr. Subarna
यूपी के
Goswami.
बहुत ही उम्दा डॉक्टर है.
Dr. Ranjit Kumar, our secretary general.
सबका हो गया ना?
Dr. Ajay Chaudhary, President AIFGDA Rajasthan. I would like our senior leaders of AIFGDA to please come on stage, and our organizing secretary, Dr. Swarna, will felicitate you. Dr. Taba Khanna.
उज्ज्वला पाटिल
It's time to
Dr. Swarna, sir, please welcome our senior guest, Dr. Ujjwala Patil, madam.
we can say beauty with talent.
अभय कदम
Dr. Abhay Kadam, sir, please come on stage.
एक्स एमएमसी मेंबर है हमारे यहाँ के
Dr. Jagjit Singh, sir, please come on stage. Our organizing secretary, Dr. Swarna Goswami, will felicitate you too. Dr. Kiran Kumar, sir. Dr. Kiran Kumar from Telangana.
मोदी को बिल मोदी को बिल
Dr. Praful Kumar, sir. Dr. Balakrishnan, sir.
स्टेट बोलो स्टेट
Dr. Balakrishnan, sir, from Tamil Nadu. Dr. Praful Kumar, sir, from Delhi. Dr. Kiran, sir, from Telangana. Dr. Jagjit, sir, done. Punjab. Dr. Rauf, sir, from Kerala.
स्पीकर क्या स्पीकर
डॉक्टर हेमंत कुकड़े.
मैं
लास्ट सेशन के बाद
सर हो गया.
ग्रुप फोटो घ्यायचा
Now I would like to please request you all, dear friends, please have a group photo.
Last but not the least, my department members, Dr. Hemant Kukde, Dr. Swati, Dr. Sachin Patil, and Dr. Naren Kumar. All this hard work of CME, coordination within last week has been done by all this team. So I would like you to please be on the stage. And may I kindly request Dr. Gwalia sir, Halia sir, please to give them a token of love from your side.
ग्रुप फोटोला बोलवा सर. ग्रुप फोटो के बाद सर इथे सर पेटा परत निघून जाणार सर. ग्रुप
Okay, now can we have a group picture? All the dignitaries present up on the stage. I request all of you to please raise.
सगळ्यांना घेऊन या अमोल इकडे. पुढे एक फोटो काढू सर. अमोल
हाँ आ जाइए. I request all the respected dignitaries, all my doctors, please come forward. Let's have a group photo. स्टेज पे भी आ जाए. हम थोड़े लोग यहाँ पे भी
थोड़े नीचे भी बैठ सकते हैं, नीचे के स्टेज पे. थोड़ा एडजस्ट करिए एक दूसरे को. हाँ, कुछ ऑफिस बेरर कुर्सी पे बैठ जाओ.
Dear friends, after this group photo,
let's have a group picture.
Important announcement, dear friends. After this group photo, we will continue our CME, last session of our CME, followed by lunch. Then we will start state-wise presentations.
एक मिनट. हाँ. Okay, 1 minute. Can we spread more? Can we? फोटोग्राफर बराबर मिल रहा है आपको? एक सेकेंड. नहीं, पीछे भी है काफी लोग.
फोटोग्राफर तुम्ही अरेंज करा, तुम्हाला कळणार आहे. आम्ही काय कसे उभे राहणार इथं.
Come on. So, are we ready? 3, 1, go! Say cheese! नहीं यार, सबको खाना की भूख लगी है तो इसलिए पनीर याद आ रहा है. कुछ ही देर में होगा लंच ब्रेक. Once again, 3, 2, 1, look in the camera and smile! Come on. 3, 2, 1, hip hip! Hip hip! Hip hip! Please do not go. एक फोटो मेरे को भी लेना है ये टीम के साथ. इतनी प्यारी मेमोरी कौन वो करेगा. आगे आ जाइए, थोड़ा आगे आ जाइए आप. क्लिक.
मौका भी है, दस्तूर भी है.
Thank you. Done? Thank you.
Thank you, sir. Please be seated again because we have one session.
Yeah, thank you. Yeah. Yes. Yeah. Thank you.